Good morning and welcome to the I Want to Be a Vet program for the online viewers as well. Our smaller group of local attendants are also here with us this morning. They have seen some things already this morning on campus and enjoyed a little walk over campus. And just to say welcome to the hospital and to the campus itself, I asked a group of final year students that were sitting outside with one of the patients just to say hello quickly. And they've got a patient that you can see. We won't say a lot of the personal information about the patient, but we can say a little bit about what we do in the mornings. It's Saturday morning, and why are you here Saturday morning?
So, hi guys, my name is Kershal, and this is half of the repros team who's on this clinic right now. This is Henning, Mampo, and Logs. We've come in this morning for weekend duty rounds. This is Harley. She's only 11 months old. She looks like an old young woman. So she's actually here for frozen semen AI. So she's here for estrus monitoring and detection. So our job every morning is to collect blood from her and see which stage she is in so that we can inseminate her at some point. So yeah, she's here to make more of herself. Yeah, that's all. She's very cute and loving, and yeah, that's all about her.
Thank you. Yeah. Thanks for your time.
Thank you.
And you can continue with your job now. Thank you very much.
Enjoy, guys.
Okay, so to those people that are at home and to everybody here, welcome to the campus once again. So yesterday we had some discussions about what a veterinarian does and what a veterinary nurse does, and also what it takes to get into the program. Are there any more questions from yesterday, now that you've been thinking about it? Or are all your questions answered? You understand what it takes to get in, you understand the selection process, you have a good understanding about what the job is about. You've seen a little bit now, just a little bit, but there's a lot more, obviously, that happens within the professions and in our hospital here. Okay, so if everybody is happy and had enough to eat this morning for breakfast, we can continue with the program. Tumelu, I don't know if we want to go to a first video now or what is next on your program. Is Michael next on the program? Okay, is he around? Is he still outside? Okay, while we're waiting for him, we can talk a little bit about what you guys saw this morning with the cattle insemination as well. So those of you who are at home, we managed to quickly have a look at the insemination of cows that was happening on campus. So we had a group of students that are working on a project where they synchronized a group of cows for insemination, which was happening this morning. So how that works is that a cow needs to be in estrus, as we call it, so she needs to be receptive to the bull for breeding. But there are technologies that we can apply, veterinary technologies, to synchronize the estrus so that all of them come on heat or are receptive to the bull on the same day at exactly the same time, which is what we did here. We call that estrus synchronization, and then we do artificial insemination or AI on the last day, which is today. And then we wait for a certain amount of time until we can do a pregnancy diagnosis or a pregnancy check, and then we confirm whether it was successful. So more or less 50% of the inseminations usually are successful, not everyone, and then we try another time. So we synchronize the cows then for a second time and we try to inseminate them again. That's how that process works. Are there any questions about that? Anything that you saw that you want to know more detail? Yes. We got, just wait for the roving mic.
Okay, so if you're like inseminating the cow, you know, like for a sperm to be in a human, it's like for 3 days. Now with the cow, it's how long?
How long the sperm will stay alive in the cow?
Yes.
Okay, that's a good question, because when we do artificial insemination, the semen is very much diluted, so that we can reproduce the bull many times. So the purpose of artificial insemination is to make it possible for us to use a very good bull with very, very good genetics and multiply him over a number of cows. So all the cows this morning were inseminated by the same bull, by semen from the same bull. So because we do it like that, the semen is very much diluted, and therefore it doesn't survive so long as in a natural insemination case. So it survives for a shorter period of time, and because of that, our timing needs to be fairly precise. So we need to inseminate at a very specific time. Otherwise, it's not successful.
Now, how sure are you, like, this cow is going to inherit, like, very good characteristics of the bull? How sure are you?
Yes, very good question. How sure are we that we are breeding with the correct bull and that it will be good characteristics? There are very good techniques available now to determine the genetic potential of the bull in terms of its productivity, its adaptability in an environment, its fertility of its offspring. So there are very good techniques that we use, and we use those technologies to select a bull for our specific circumstances on the farm. So every farm will have very specific ways in which they select bulls for that purpose. And with artificial insemination, it's possible that we can get access to the genetics of a bull that's not even on the farm. He lives somewhere else. But we can get access to his semen and to his genetic potential, which is why we are doing it.
All right, thank you.
I wanted to ask if it's possible to clone a cow or a bull instead of the whole artificial insemination.
Well, there are other technologies. So even before cloning, there's embryo technology. So you can have embryos, in which case you reproduce the genetics of the female as well, where you can harvest embryos from a female and then put them into another recipient. With cloning, that's a little bit further advanced, and it's not something that is done commercially, but it is possible to do, and it has been done in South Africa as well by a veterinary practice. Has done cloning successfully in cattle before. With cloning, it becomes a little bit of an ethical question, whether cloning should be done or whether it shouldn't be done. So cloning is not something that we are really advancing at this stage in science. But embryo technology, yes, there's a lot of work done on that. Commercially, there are a number of veterinary practices in South Africa that do embryo transfer in cattle and sheep and in horses as well, and in goats as well. So in a number of different species, and they're very successful. So the technology is already well established, and veterinarians are involved in those programs. So there are practices that specialize in embryo technology and in artificial insemination like we did this morning. More questions? There's a question on this side.
So how do you know that the cow is on oestrus after synchronization, let me say, yeah?
Yes, good question. How do we know if the synchronization was successful? So when we do it in the way that we did this morning, what you saw now, we do what we call a fixed time insemination. Fixed time meaning that we are not going to try to determine for every cow if she is in estrus. We do it on a fixed time. At 8 o'clock this morning, we started inseminating. But there are ways to determine, like in the dog patient that you saw now, we can measure certain hormone levels in the blood to see. And we can use other technologies like ultrasound as well to see if she has a follicle that's ready to ovulate. We can look at external signs as well. So there are many different ways that you can use. And also technologies that you can use to see if the cow is on heat.
All right, thank you.
Okay, there's a question from the online group. What professions would I be able to venture to with veterinary sciences? So as we mentioned yesterday, Veterinary science itself, to become a veterinarian, you have different options in career. So you can be in a private practice in small animals or in large animals or in a mixed practice, or you can work in government practice in state veterinary medicine. You can work in veterinary public health, where you work in abattoirs and look after meat safety and milk safety. So there are many different directions for veterinarians. You can work in technology as well. And then the other professions, what we call the paraveterinary professions, the one that we teach here at Onderstepoort is veterinary nursing. And they specialize in patient care. So mostly in small animal practice and in mixed animal practice and in equine practice. But there are also opportunities in industry, and nowadays it's also possible for veterinary nurses to open their own business and to have, for instance, a vaccination clinic and primary animal health care. So those all are options at the moment.
So I wanted to ask if are cows less restless than heifers when artificially inseminating?
Sorry, just repeat your question. It wasn't clear.
Are cows less restless when artificially inseminating than heifers?
Oh, yes, because you saw this morning one heifer that was a little bit restless, a little bit nervous. Yes, generally cows are more relaxed because they are more used to being handled, and heifers still go to school. We always say they're still going to school, so they're still learning that we work with them and that they go through a crush, and sometimes they get a little bit anxious and they start panicking and they start moving and so on. Yes, cows generally are more relaxed, and heifers generally are a little bit more nervous. And we see the same in all the species. The young animals are usually a little bit more unsure, and we need to work very nicely with them and get them accustomed to us and to being handled. And then as they mature, it becomes easier to work with them most of the time. I see we've got a new question. Will you be going over the admissions criteria? Yes, we have a session, a question and answer session right at the end when we will look at those again. And there's another question. How many of the 190 students that gets admitted every year go on to graduate? So we are quite proud in this faculty that our academic success is really good. Some of the best in the country for our students in both programs, for veterinary science and veterinary nursing. So we do have dropouts. It happens in all university setups that some students don't complete the course, but it's a small number at this faculty. So we have a very good success rate. So in veterinary science, we graduate around about 170 students every year. And in veterinary nursing, around about 30 to 40.
I would like to ask if the artificial insemination, does it sometimes, because it looks kind of painful, so does it sometimes lead to a cow having maybe, what can I say, maybe being sick or having other, like...
No, it's not painful for the cow. What you saw this morning was just a heifer that was panicking. It's not painful for her at all. And there are very little complications, almost no complications from artificial insemination. So it's a very safe procedure for the animal. Although it's a little bit different to natural breeding, that's why we call it artificial insemination. But the technology has been developed over many years. So in cattle, artificial insemination was started in the 1950s already. And technology has been improving year after year as we do research to improve the technique and so on. So a lot of that is focusing also on the welfare of the animals to make sure that the animals are comfortable and that it doesn't have any negative side effects on them. Yes, it's a good question because we always have to consider that, whether the procedures that we do are safe and animal friendly. And that's our job as veterinarians and veterinary nurses, to look after the welfare of the animal. So a lot of the research and work that we do focuses on that. We also know that happy animals are healthy animals, and healthy animals are productive animals when we talk about farm animals. And obviously for pets, for animals that live in our homes, it's very important that the animals are comfortable and happy because they form part of the family.
Can I please ask, why do all the cows have to be in estrus at the exact same time? Won't that limit the number of cows the bull can make pregnant?
Yes, but in this case, it's not the bull's job, it's our job. So it's a very good question. Why do we want them all? When we do artificial insemination, we have to set up the whole procedure. So it's convenient for us if it all happens on the same day, because we can prepare and we can have the semen ready and we can do all of them one after the other, and then the procedure is done. So we do it to make it more convenient so that it's easy to do the procedure. But it's not necessary to do that like that. You can also do estrus observation, where we just go and look every day which of the animals are receptive to the bull. We pull them out and we do artificial insemination on the one animal only. It is possible. And many farms will do it like that as well. But as soon as you work with a large group of animals, especially with sheep, where we have herds that are hundreds of animals, it makes a lot of sense to inseminate them on the same day, do the procedure, and then they can carry on with their lives. When it was for the bull, you don't want them all to be in estrus on the same day, because it will confuse the bull.
Okay, so how do you go on about extracting semen from a bull? And what is that process called?
Semen collection. So there are different ways. I don't know if we must go into a lot of technicality on that today, so I can tell you maybe a little bit later. But there are different techniques that we use to collect semen from male animals. And then there's very specialized techniques to preserve the semen. We freeze the semen at a very low temperature to preserve it. And it can be preserved like that for a very long time, for decades. And it's still useful, which is amazing. So you can also store genetics of a male animal and of a female animal for a very long time to use in future. Because sometimes there are genetic characteristics of animals that we don't even know at this stage already will be valuable in future. And in future we might find out that there was a bull 20 years ago that has a very specific characteristic that we want to replicate, and then we can access the genetics from that animal. So it can be stored for a long time. I think there's a question in the front.
Are artificial insemination more effective when done twice? Because when I was shadowing, we did it early in the morning as well as later in the evening with the same heifers.
Yes. It's possible to do it more than once, so that you do 12 hours apart, and yes, it improves the success rate a little bit. By more or less 10% or so. We've got very interesting questions online here. Do cows menstruate during heat? And another person asking more or less the same question. So the reproductive cycle is a little bit different between humans and the animals that we work with, the domestic animals. So they don't menstruate. But there is a discharge from the female animal when she's on heat, at the time when she's on heat. But those of you that are taking life sciences might have learned at school as well that the cycle is a little bit different in animals. So in humans with menstruation, that happens in the middle of the cycle, not at the time of ovulation. And in cows, for instance, there is a little bit of a discharge, but that happens when she's on heat, so at the time of ovulation. So it's a little bit different. And in the program, when you study with us, you will learn all these details of the differences between different species, also compared to humans. It's very, very interesting to understand how the physiology works in different species. Reproductive physiology is only one, but there's so many other things. If I can mention just one, the gastrointestinal physiology, how that differs between animals that have got only a single stomach, like us, and then cattle and sheep that have got what we call 4 stomachs. So they've got different stomachs before the real stomach like ours, where food is first ingested and then it ferments in there. So it stays in there and then they bring it up again and they chew it again. We call that rumination. So they ruminate, and then they swallow it back again, and then it goes back into the true stomach like our stomach. And that's also very fascinating to learn how those processes work and how the different animals are adapted to have different behaviors according to their own physiology and anatomy. So every species has a specific anatomy and a specific physiology that's adapted to its way of eating and the food that's available to it. We can't eat grass, right? We can't go out there and eat grass. We can, but we won't survive if we eat only grass. And other animals have been adapted to eat grass only, and they survive on that. And how the body was created to adapt to those different environmental conditions is really fascinating to learn about. There's a question, please can you tell us about the research programs at OP? We've got a number of different research programs. It's maybe too many to answer all of them, but I can just say that we have the 5 different departments on campus. So we have the biggest department is called Companion Animal Clinical Studies. So they do clinical research, mostly on companion animals, in other words, pets and horses. And their research focuses on improved technologies to look after the health and welfare of companion animals. So they would look at new medical technologies, new diagnostic techniques that will improve our ability to recognize diseases and to treat diseases in animals. And they also have what we call a transdisciplinary approach, so where we compare the work that they do with human doctors, because the fields are a little bit similar in a way. And then we have the Department of Production Animal Studies, also a very big department, and they look after the production and the health and welfare of animals that produce food and fiber, so that will be cattle, sheep, pigs, poultry, goats, and so on. And their focus is more at looking at the welfare and the production side to see how can we improve farming techniques, looking after the productivity and the wholesomeness of the food that's produced by animals as well. So that's a very important research area because veterinarians play a big role in the economy, in the rural economy in South Africa, in improving profitability of farmers, making it possible for us to produce more food and better quality food from animal background. And then we have a Department of Veterinary Tropical Diseases. So their research, it's a research intensive department as well. Their research focuses on all the diseases that we see in Africa. So it's all the infectious diseases like viral diseases and bacterial diseases and parasitic diseases. And the Dean, Prof. Naidu, mentioned yesterday when our faculty was started by Sir Arnold Tyler, a bit more than 100 years ago now. When he arrived here from Switzerland, he realized that things are very different in Africa in terms of the diseases that we have on this continent. And a lot of research has been done over the past 100 years to find ways to solve the problems with the local diseases that we have here. It's not only the infectious diseases, we also have very special plants that can be poisonous to animals. And that's in a different department. It's called the Department of Paraclinical Sciences, where we look at interactions between plants and animals as well. And in that department, I also have the section of pathology. So pathology is the study of things that went wrong disease-wise. So they do post-mortem examinations on animals that have died, and they try to make a diagnosis from that. And they also do a lot of research to find better ways to diagnose diseases at post-mortem level. And then we have the Department of Anatomy and Physiology. And when you start as a student with us, it's the first department that you will meet because they teach the students the foundational information about physiology and anatomy. And they do a lot of research in comparing the anatomy and physiology between different species, which is really interesting to understand how the body works and why it works in a specific way. From that, we can understand when things go wrong, why things go wrong as well. So that's the research focus that they do. And then we have a few specialized research centers as well. So we've got a wildlife hub that concentrates research on wild animals. And we've got specific research focus areas also around horses and around poultry that look at very, very specialized research. I think there was a question.
I think you already answered it.
Oh, okay. Thank you. I think we've got one more online question here, and then we'll go to the question at the back. So another online question, are there any specialities that can be done after graduation? We did discuss this yesterday, so let's start with veterinary science. So as we said yesterday, it takes 6 years to become a veterinarian, and then after that it is possible to specialize. At this vet school, we have 18 different specialities that you can train in after becoming a veterinarian. But you can't do that right away. You first have to go and work in your compulsory community service year, and then you have to gain a little bit more experience, and then you can enter one of the specialty programs. And those programs generally take at least 3 years, but it can take a little bit longer sometimes. And then for the veterinary nurses, there are options to further your studies. There are no real specialities that are recognized by Veterinary Council at this stage for veterinary nurses, but these things will still develop in time. So veterinary nurses typically focus their career on, for instance, intensive care or in theater. I think Tumelu said quite a lot about that. So maybe we can ask you to repeat that at a later stage today. But the different fields for veterinary nurses that you can specialize your career on. Because you mentioned them. Do you want to do it now? You can do it now. Come up. In the meantime, we have a question at the back.
I heard that you were talking about plants and how they can use them to cure diseases and all of that. I wanted to ask, when you pick to study veterinary science, do they also teach us about that, or do you have to like pick to study about plants so that you can be able to know that?
Yes, thank you. Good question. Because there are a lot of traditional medicines that come from plants. And we have a very focused research laboratory at the faculty that looks at that. That's called the Phytomedicine Laboratory. And we also have a course in the veterinary degree where students are taught about different traditional plants that are used as medicine and the research that's been done on it. So you can specialize in that field after graduation, but in the normal program, veterinary science, you will also be taught some of the basic things about it. So the veterinary degree is quite comprehensive in that it covers a lot of different fields, but obviously it's not possible to go into the finest details. But we do teach our students on the principles that are applied for phytomedicine as well, or ethnomedicine. We call it veterinary ethnomedicine.
As Prof said, I'm Tumela, and I'm also a second-year veterinary nurse. So with veterinary nursing, the different fields that are there, so how it happens is from the time you graduate, which is after 3 years, you can work with any species of your choosing and try to apply for practices that specifically work on certain species, although most of us end up in private practice where we deal with companion animals such as cats and dogs, but there are other clinics that offer equine or wildlife or exotics. So as a veterinary nurse, you can work as a exotic animals veterinary nurse from the time you graduate. And if you want to further your studies, you can end up in fields such as anesthesiology. So you can be an anesthesiology nurse, which monitors anesthesiology during surgery. You can also be a theater nurse, which are the people that are involved in making sure that theater is prepared the way that it should be, and that all the theater procedures are done the way they're supposed to be, such as making sure that the sterile field is maintained at all times. You can also end up in patient care, which is then taking care of patients, whether they are sick or you're providing medication or making sure that they clean if anything is wrong with them. So there are different fields for veterinary nurses as well, where from the time you graduate, you can be in certain clinics that offer that special service, or you can, for some other ones, you have to come back and do your specialty. So the specialty is a 1-year postgraduate diploma, which is offered here as well. So you can come back here and study for a year, and then you also specialize in a particular field of your choice.
Okay, so there's one question now that says, what other vaccines do you produce other than African horse sickness? So just for clarification, that the vaccine factory that's also has the name Onderstepoort is not associated with the university. It's across the road from us. So when the Onderstepoort hub was started, just a little bit of history by Sir Arnold Tyler 100 years ago, that facility was across the street from here. So there's some old buildings there from the 1920s and even before that, where veterinary science as a discipline started in South Africa, where the research started. And the faculty then started there in 1920, so just over 100 years ago. And that's where the vaccine factory nowadays is as well. Onderstepoort Biological Products is across the road. So we do research on the development of new vaccines, but we don't produce them at the university. So at the university, we do training of veterinarians and veterinary nurses, and we do research in new biotechnologies and so on. But we don't actually go into the commercial side. That's done by commercial companies. And then another question, can I study veterinary science if I have a bachelor in veterinary technology? So that's a good question. As we mentioned yesterday, the answer is no, you can't do that directly. You first have to enter a BSc program. So if you want to change over from any other tertiary education program into veterinary science, you have to go into BSc and then apply from BSc. You can't enter from another program. But we'll have a Q&A session later still on the admissions as well, so we will focus more on that. Any more general questions? No questions about the rumen and how cows eat grass and anything like that? You all know that. Michael, don't ask a difficult question.
You can maybe give them information about Frenchie, our rumen donor, and how that entire process works.
Yes, fantastic. Okay, maybe this group can go and meet Frenchie later as well. So we have a cow on campus here called Frenchie, and she's a rumen donor. I'm sure you haven't heard about that. Who knows what I'm talking about even? So, who of you are blood donors? You know what a blood donor is? It's somebody that gives blood to patients that need blood for whatever reason. Maybe they were in a car accident or something like that. Just like you have a blood donor, or you might be a blood donor yourself, we have a rumen donor. So it is a cow that lives on campus here who donates her rumen content or her stomach content to other patients that are sick. And where the rumen, which is the biggest forestomach, is not functioning normally, we need to do what we call a transformation, or we take rumen content, stomach content from Frenchie, and we put it into the patient to make her better, because maybe she can't eat at the moment or there's a problem with her. And how we do that is we put what we call a fistula, which is a small little tube that goes through the skin on her left-hand side directly into the rumen. And we put a plug in there, and then when we need to collect rumen fluid from her, we put a tube in and we collect rumen fluid from her. And then we have rumen fluid that we can put into another animal. Is that fascinating? And rumen fluid is alive. If you put it under a microscope, you see a lot of things that are alive in there. So inside the rumen of a cow or a sheep, there are a lot of organisms that live there, and their role is to break down the grass that the cow or the sheep is eating. And because we don't have a rumen, that's why we can't eat grass. Well, we can, but we won't survive. Because we don't have those organisms that can help us to digest grass. But cattle and sheep can do that. And horses work in a little bit of a different way, that they have a normal stomach like us, but then they have a fermentation system in their large bowel, where they also have organisms that help to break down, just like in the ruminants. So later on you can meet Frenchie. She's very friendly.
So just out of curiosity, if we were to ingest rumen into humans, would we then be able to eat grass, or will the rumen not be able to survive in our bodies, or will it kill us or something like that?
Yeah, very good question. You're thinking the right way, because the body and the physiology, so the anatomy and the physiology must be designed to work together. So if you take rumen fluid and you put it into a pig or into a human or into a dog, it's not going to work. So two things will happen. Our stomach will digest and will kill the rumen organisms, and it will also make us sick, because we are not supposed to have rumen content in our stomach. It doesn't work out. So yes, you actually gave the answer. You figured it out. Well done. There's a question in the front.
Does this process have any effect on Frenchie or not?
When we steal rumen fluid from her.
Yeah.
So if you donate blood, does it got an effect on you?
No.
Yes, a little bit. You feel a little bit dizzy maybe when you stand up.
Yeah, but we
and
don't get sick.
you can only donate a certain amount of blood in a certain time. So just the same applies to Frenchie as well. Because we take a little bit of content out of a rumen. We can't take all of the content out of a rumen because it will affect their own health. We can take a certain amount, and we can take it with a certain frequency. But because it's stomach content or rumen content, if she eats, she will fill the rumen again. So we can actually collect rumen fluid from her much more frequently than what we can collect blood from a blood donor, for instance. Because it takes a certain number of days for you to regenerate blood. But for her, if she eats, she will fill up the rumen again. So you can do it quite frequently. In private practice, in veterinary practice, there are other ways to do this as well. So you can go to an abattoir, for instance, where cattle or sheep are slaughtered, and you can collect rumen fluid from there that you can then use to treat patients with. It's also possible.
How did you choose Frenchie as your rumen donor?
Just say again, please.
How did you choose Frenchie to be a rumen donor?
How did we choose Frenchie? Oh, yes. So the most important thing is to have an animal that is docile, that's easy to work with, that doesn't mind if you put her in the crush, and where it's easy to collect the rumen from her. So that's the main factor that we look at. And then also a little bit more technical things, that you want an animal that is not going to become very fat, because she's not producing calves or milk or anything like that. Her role is just to produce rumen fluid. So because of that, these animals tend to get a little bit overweight over time. So we have to select an animal that will remain fairly slender. Otherwise, we can't keep her for a very long time.
Thank you.
So do you do incision every time you need to collect the rumen fluid?
No, no, we don't have to do an incision every time. So we have the fistula, which is a plastic opening that stays there permanently. Yes, you will see that. So it stays there permanently, and we just have a plug that goes in to close it off. We open the plug, we can collect. So it's not painful to her at all. It stays there permanently. It's a small operation when we put the fistula in the first time, and then it stays there.
I want to ask do you collect the rumen fluid when you need it, or Do you store it?
Yes, no, you can't store rumen fluid for a long time. So blood you can store for a long time, different ways, or for a relatively long time, not forever, but for a relatively long time. Rumen fluid you have to use the same day. It doesn't survive outside of the rumen for very long. So you can keep it in a warm place. If you can keep it at about 37 degrees, it will survive for a few hours only. So that means that you have to collect every time that you need to put fresh rumen fluid from one animal to the other one. Yes. Good question. No more questions? We will meet Frenchie later. Michael, over to you.
Welcome, everyone. Thank you for the ones that are attending online and for everyone to attend in person. So for those who do not know, my name is Michael Jansen van Rensburg. I am the chairperson of the OPVSC. So the OPVSC, we are a student representative council, and we sit on meetings and committees about the curriculum at Onderstepoort, and we discuss with different people the different aspects of the degree, and we make decisions based on a few different criteria. We also arrange quite a few socials and wellness events all around campus throughout the year to help have a balanced life here at OP, because that is a very important part of the veterinary profession, is to have a very balanced life. So the committee comprises of quite a few members. We are 10 at this point. Unfortunately, all of us are not available to assist at this event, as 2 of our members are in clinics and not at Onderstepoort at this moment. But the ones that are able to assist are myself, the chairperson, Sarah Kilfoyle, the vice chair, and the clubs and societies rep, Tumelo Motokoa, who is our community engagement rep, and he is also the one who is responsible for planning this event that you're attending right now. We also have Christian Bronkhorst, who is the academic rep, and Amanda, who is our secretary, and Tsidi, who is our transformation and wellness rep. So with the different portfolios, there are different aspects in the committee that have to be balanced and sorted out, kind of. So with the transformation, she of course handles the transformation and the wellness events to help students in need. She also has contact details of people that you can contact if you are struggling mentally. We also have the clubs and societies rep who handle all the logistics behind the clubs and societies and enrolls them in the different sporting events at UP, not just at Onderstepoort. So to elaborate a bit more on that, there are quite a few different sports and clubs at OP. We have everything from rugby, netball, volleyball, tennis, hockey, all the way to a cappella and choir, and even sometimes a debate team if there's enough interest. So here at OP, there's no shortage of opportunities to keep yourself busy throughout the year. And yeah, that's basically OPVSC. Are there any questions for me about the committee?
How do you choose the members of your committee?
Okay, that's a good question. So we're actually starting with the selection process now. So there's an entire process of candidate nomination and very complicated story, so I'm not going to elaborate much on that. But it's basically you apply to the selection process, and then through different criteria, they determine whether you are eligible to run for OPVSC. And then you have a period where you can advertise yourself, and kind of like the presidential elections, the election period where they advertise themselves and say, choose me because of this, that period. And then after that, there's a short voting period where the entire Onderstepoort community vote on who they believe will be the best chairperson. and through those votes, they determine the chairperson, and then the chairperson after that can decide who gets the portfolio. Okay. Any other questions?
Do you have horse riding as a sport? Horse riding.
Horse riding. So horse riding is not an official sport here at OP, but we do have a horse riding club. I believe it is going to be mentioned in a presentation after myself, but it's not a sport that is offered here at OP. The horse riding club just offers training with horses, and then from there, I believe you can apply to clubs close to Onderstepoort if you want to compete at that level. Any more questions? Okay. If not, I believe we have quite a few videos that we will be showing you now, and then we'll be talking about all the different clubs and societies that are offered here at OP. Thank you.
Hello everyone, and welcome to our annual I Want to Be a Vet Professional Weekend. This event was established to expose young students to the veterinary profession. We hope that in the future there will be a lot more veterinary professionals all over the communities of South Africa and even the world.
Throughout the course of the day, we will be taking you on a tour of our prestigious campus and showing you the various activities that students are exposed to. We will open the floor to questions at the end of the session.
Hello everyone, my name is Michael Janssen van Rensburg. Did you know a baby goat is called a kid, and a goat giving birth is said to be kidding, and that ain't no joke. Next, I will be giving over to my colleague, Darina Basson, who will be taking you through a short video on the basics of goats. Enjoy.
We will focus on the main topics comparing goats to sheep. The behavior of sheep and goats are very similar to each other, but goats in general tend to show less social behavior than sheep do and tend to be more individualistic. Goats are more agile than sheep and are harder to contain with conventional fencing. Goats will dig holes underneath the fence or jump over the fence, which sheep do not do. Goats appear to develop a stronger bond with the caretaker and are seen as being friendlier than sheep. Goats, especially kids, vocalize a lot more than sheep do and will cry out loudly, even during non-painful procedures. Sheep do not vocalize often, even when sheared or being hurt. Goats are not as dependent as sheep on having other goats around them, so they can be worked with reasonably easy. Sheep and goats are both selective eaters, but goats show to be even more selective than sheep and prefer to browse. Sheep and goats do not display any nutritional wisdom, but they do select higher quality plants and higher quality plant parts. Both sheep and goats eat very short plant growth and will even dig up stems and roots, which gives them the undeserved reputation of being felt destroyers.
The following is an example of a body conditioning score chart to categorize the health of the goat. To do a body conditioning score, you look at the following landmarks: the ribs, the lumbar spine, and the pararectal fossa. For a body condition score of 1, the animal is emaciated. A body condition score of 3.5 is an ideal score for a goat. The ribs is not easily visible, but can be palpated. The score is ideal for goats that are in breeding and in parturition. A body condition score of 5 is seen as obese. To determine the age of a goat, you look at their adult teeth. 2-tooth is 1 year old, 4-tooth is 2 years old, 6-tooth is 3 years old, and 8-tooth is 4 years and older.
Hi, my name is Matsidiso Mokoena. Did you know that sheep have rectangular pupils, allowing for an almost 320 vision? Lishan Pillay, the Vice Chairperson of OPVSC 2021, will be taking you through the basic clinical examination and anemia in sheep.
In this video, we will explain how to safely catch a sheep to do a clinical examination and also estimating anemia. Firstly, we will show you how sheep are caught and handled. We catch the hind leg above the hock and gently pull the sheep out of the flock. We then transfer our hand to underneath the jaw. If the sheep is tame and does not run away, we place our hand underneath the jaw and reverse the sheep out. We need to ensure that we do not hold the throat, as this can obstruct the airway. We hold the sheep against our bodies. To move the sheep forward, we put pressure on the tail. We hold the chin upwards to stop the sheep and reverse it by holding the chin up higher. We can use our bodies to guide the sheep in the desired direction. It is important that we do not pull on the wool or catch the sheep below the hock. Next, we will show you how we set up and examine a sheep. We restrain the head of the animal with one hand by holding it underneath the jaw, with the thumb over the nose and the other hand holding the flank fold. Then we turn the head towards the flank, lift the flank and twist to set up the sheep. We cradle the sheep in a set-up position against our legs. We can now examine the nose, mouth, both eyes, both ears, as well as 8 claws. We also examine the belly for wool cover and then the udder if it is a ewe. To estimate the degree of anemia, we restrain the head by holding it underneath the jaw. We examine both eyes and look at the mucous membranes. We hold the Famacha scoring card close to the mucous membranes and note the color and level on the card that corresponds with the sheep's mucous membranes. The Famacha score ranges from 1, which are red mucous membranes, to level 5, which are very pale mucous membranes. We administer antiemelatics to all animals that score under level 3. As you can see, this sheep will be a level 2, thus no dosing is required. The Famacha chart was designed by Dr. Fafa Milan, who is a South African production vet. We commonly perform Famacha during the Haemonchus catortis period when we have a high worm burden. It is important that we look at both eyes when we want to estimate the degree of anemia.
That's my default. I mean, that's one way to do it. Yeah, that's yes. Yes.
Hello everyone, my name is Amanda Mukontom. My colleagues will be taking you through a short but interesting journey to meet our pigs here at Onderstepoort campus.
The facility at Onderstepoort Teaching and Animal Unit is specifically designed such that it resembles a model defined by the South African Pig Welfare Code. The following is the structure at our facility. a boar pen. This is where the boars camp. Dry cell crate, for the purpose of artificial insemination or mating. Dry cell crate, mostly used for biostimulation. Farrowing pan, where piglets are kept until weaning at about 21 days. In general, when handling pigs, you try to make sure that you limit long periods of handling, as these can be stressful to the animal. What to do? Handle one pig at a time. Approach the pig from behind. Snout restraint using a rope over the canines of the maxilla, used for procedures such as artificial insemination. What not to do? Do not approach the pig from the front. Catch the pig using the front leg. This is most likely to cause dislocations. Avoid handling animals for long periods.
Pigs are normally moved around for various reasons. This is generally done using pig boards. But before you let the pig out, ensure all gates or doors that could lead to escape are closed. This practice is normally done for the following reasons: for examination, for example, lameness and weighing, or moving the adults in and out of a crate or different pen. For an interesting fact, pigs are actually considered to be the fifth most intelligent animal in the world, even more intelligent than dogs.
Hi, I'm Chris. This is friendship. In ancient Greek, if you talk about someone's cow brown eyes, you're giving them a compliment. So try that on your love interest next time. Humaira Mohammed from the 2021 committee is going to tell you all about injection sites in cattle.
I will be explaining how to herd cattle and also the different injection sites we use in them. We need to take into account the different herding behavior characteristics of cattle. Firstly, we will discuss vision. Cattle's eyes are positioned on the side of their heads. Wide panoramic vision allows the animal to have a view of 330 degrees on the side and narrow binocular vision of 25 to 50 degrees in front of them. The area directly behind them is a blind spot. This means they cannot see us if we are directly behind them and should never be approaching cattle from behind. They can be startled and react by kicking. The fight or flight zone is the next item on the list we will need to consider. The flight zone is also called the animal's personal space. If we move inside the zone, the animal will move away, and when we back off, the animal will stop moving. The size of this zone depends on how tame or wild the animal is. It is more difficult to move very tame cattle because they have almost no flight zone. Next is points of balance. There are 2 points of balance. Looking from the side, it will be behind the shoulder. From the front, it is the center of the head. When we move close to a cow confined in a chute or against a fence, our position in relation to the cow's shoulder will affect the direction in which it will move. The imaginary line through the shoulder is the point of balance. If we go behind the line, the cow moves forward. And if we go in front of the line, the cow moves backwards. If we are moving towards the front of the cow, it will move backwards or turn away. From the front, we can deflect the cattle sideways by moving either side of an imaginary line drawn through the middle of the animal's length. With regards to the injection sites we use in cattle, always use a clean syringe and needle when performing any injection. We do intramuscular IM injections in the neck, gluteus, semimembranous, or semitendinosus muscle. The neck muscle is the preferred site, and it is important not to inject between the semimembranosus and semitendinosus muscles. We desensitize the area first by tapping hard with the side of the hand before injecting, and always aspirate to check that there is no blood before depositing. Subcutaneous, subcut injection sites are mostly used as most vaccinations are administered this way. Subcutaneous injection sites are any area with loose skin, for example, the neck or behind the shoulder. We do not need to aspirate before injecting. Lastly, we do intravenous or IV injections. We use the jugular or neck vein for large volumes of medication or blood collection. The coccygeal vein, also known as the tail vein, is used for small samples of medication and diagnostic sampling. We aspirate before injecting to confirm that we are in the vein.
Hi, I'm Christian Bronkhorst, 2023 Academic Representative for the OPVSC. Did you know the first written regulation of the veterinary profession dates back to ancient Rome? Just like 2,000 years ago, it's important to know how to handle horses. Nadine Steiner from the 2021 committee is going to tell you more. And Leafy?
When we approach a horse, we do it in a confident, safe manner while informing the animal of our presence. We need to pay special attention to the body language of a horse. For example, if the ears are flattened and pinned back, it indicates possible aggressive behavior. Ears that are facing forward indicate friendliness or an interest in what's going on. When the horse is swishing its tail, it can be a sign of irritation or even an anti-insect response, while tail raising can mean intention to move or arousal. Horses are usually trained to be approached and handled from the left-hand side. When we handle a halter and lead, it should be kept neatly and held correctly to ensure quick application. We should put on the halter in a fast, safe, and smooth manner. Afterwards, we ensure it fits correctly by applying the 2-finger and fist rule, which is 2 fingers above the muzzle, 2 from the facial crest, and a fist below the jaw. When we lead a horse, we do it from the left-hand side. We stand at the horse's shoulder or neck, looking forward. Both our hands on the lead rope without wrapping it around our fingers or hands, and we gather the excess rope. Next, we will explain how to lift a horse's leg and clean its hooves. We start at the front leg, keeping contact with the horse and slide our hand from the shoulder down to the foot. To make sure the horse picks up its foot, we gently apply pressure on the flexor tendons or sesamoids.
It stabilizes you, so if the horse walks or tries to move, then you move with it. You've got good contact there with the shoulder.
So you can control
it makes the horse feel more comfortable as well, and they can rest on you a little bit as well. And if you do this, it's not on your back, otherwise you get back injuries, so it's more on your knee. You put the weight on your knee.
Once the horse has picked up its foot, we grasp the pastern or hoof wall and clean it out with a hoof pick. Remember to always use the hoof pick to clean away from you, as you can injure the frog of the hoof. When we are done, we carefully lower the foot to the ground. The hind leg is slightly different.
It's it's very important to start at the front, so the horse must know you're here. And what I do is touch the horse with my body as well, not only my hands. And then go to the back and I get my knee there already. And then step backwards. So now she's immobilized. So just pass me the hoof pick. I can't pull one. And then when you clean, you always clean in that direction. Away from you. Otherwise the hoof pick gets stuck in the frog there. So this way you clean it out without moving. And then when you let go, you must always put it down. Don't drop it.
Hi everyone, I'm Sarah Kilfoyle. At OP, it is vital that we learn how to handle our animals in a safe and effective manner in order to perform a thorough clinical exam and to make the best diagnosis of our patients. Leonie Yabad, the academic rep of 2021, will be demonstrating how to take the vital parameters of a dog and how to perform a basic clinical exam.
In this video, we'll be showing you how a dog is handled in a clinic to perform a clinical examination and how to take vital signs. Firstly, we have to ensure the safety of everyone as well as the patient. We approach the patient calmly and confidently. Never leave the patient unattended on a table. We will now start the hands-on examination by looking at the vital parameters. This is commonly referred to as recording the TPR. TPR stands for temperature, pulse, and respiration. The body temperature is measured rectally, and a normal temperature ranges from 37.5 to 39.5 degrees Celsius. Next up, we measure the pulse. We need to locate the femoral artery, which runs on the inside of the hind leg. After we locate the artery, we palpate it with our index and middle fingers for a minute. The normal range in adult dogs is 80 to 120 beats per minute. Heart rate is usually determined at the same time as the pulse rate. We place the stethoscope on the left side, between the 5th and 6th rib, and when we lift the leg, slightly behind the elbow. Here we can hear 3 of the dog's full heart valves, which are called pulmonary, aortic, and mitral, or PAM. The 4th heart valve, the tricuspid valve, can be heard on the right side. For every heartbeat heard, a pulse should be felt. We evaluate the dog's respiration in 2 steps. We observe the animal while it is breathing, and after that, we listen to the lungs with a stethoscope. The normal respiration rate is 15 to 30 breaths per minute. The hydration status is another parameter we look at while taking vital signs. To determine this, we pinch a skin fold between the thumb and index finger and lift it upwards. This is usually performed on the top of the neck area. If the patient is not dehydrated, the skin will go back to its normal position within 1 to 2 seconds. We can also observe the mucous membranes to determine the hydration status. We look at the mucous membranes of the mouth or the eye. The mucous membrane should be pink, moist, and glistening. While we lift the upper lip of the mouth to observe the gums, we can also determine the capillary refill time. The capillary refill time aids in determining the perfusion of mucous membranes. We measure it by pushing down on the upper gums for a few seconds until that area turns pale. We then release the pressure and observe the time it takes for the depressed area to regain normal mucous membrane color as blood flows back into the area. The normal capillary refill time is 1 to 2 seconds. After we recorded the vital signs, we can continue with the clinical examination of the entire patient. It is performed to examine the various body systems. We follow a systematic approach where we usually start at the head and work down towards the tail to ensure that we do not leave anything out.
Hi, I'm Tumelo. For the next video, Naishi and Alex are going to take you on a tour of our wildlife clinic. This is a facility that can house large carnivores such as lions and herbivores from small antelopes to rhinos. Stay tuned.
This clinic was officially opened during the faculty's centenary year on the 6th of March 2020 by the Vice-Chancellor and Principal of the University of Pretoria, Professor Twane Coupe. The clinic consists of 2 buildings, one herbivore boma and one carnivore ward.
This is our carnivore enclosure where we safely house carnivores such as big cats while they undergo their treatment. This clinic exposes our vet and vet nursing students to excellent wildlife veterinary practice. It also enables us to gain hands-on knowledge in this field while working under renowned specialists.
This is the boma, which comprises 4 holding pens that can accommodate herbivores from small antelope all the way through to young rhinos. Our most famous patient to date was a white rhino named Oz, who was the first rhino to undergo a CT scan in South Africa. Wildlife training for veterinary students at our faculty includes a 5th-year core module in African wildlife management and conservation, as well as a compulsory rotation at this clinic. Additionally, students have the option to choose rural and wildlife practice as an elective module in their 5th and 6th year of training.
From bones to nerves to muscles, and many more. The anatomy hall behind me has it all. Hello, I'm Michael. Did you know dogs have approximately 320 bones, like Ossie here next to me? Next, I'll be handing over to Nancy, who will be taking you through a tour of the anatomy hall, as well as the museum. Enjoy.
Welcome to the anatomy hall. So this is where the students get to have a hands-on experience on learning about different organs and animal species. And this is where we actually dissect our animals and also learn about bones and the anatomy. In the anatomy hall, we have a museum that helps us to see a different perspective of the anatomy, as well as to single out different organs and focal points in the body systems. For example, we have the front lead here with the innervation of nerves in the muscles. So here, we have the skeletons that help us to see a better perspective of the muscles, the nerves, and the organs, as well as the blood vessels, and how they fit into this whole picture. Why do we actually need to know the skeletal system? That is because we do take radiographs to see any bone fractures, bone abnormalities, and sometimes pathological lesions. And here we have Leonie that will help us view better into that.
Here we have a variety of skeletons that we use during our studies. I know it looks a bit intimidating when you see the skeletons and you can't identify it. So a little tip and trick that we use is that we look at the feet. We have hooves for horses, claws for cattle, sheep and goats, and then paws for dogs. Something that we have different in our anatomy hall, and it's fun to identify, is that we have a camel skeleton. It's unique and fun.
Pathology, which is the study of disease, goes hand in hand with anatomy because we have to know the normal before we can tap into the abnormalities. So for example, we have Tulani here, which will give us an overview of the heart anatomy.
The heart is the central organ of the cardiovascular system. It is composed of the myocardium, which is the muscle of the heart. In general, the shape of the heart, it resembles a cone. This is the base of the heart, also known as the basis cordis. And the vessels of the blood vessels, they are attached to the base. This is the apex of the heart, also known as the apex cordis. The anatomy of the heart varies among different species. Now I will illustrate how the bovine heart differs from the rest of the species. The bovine heart contains extensive fat, which is whitish in color, and here you can see it actually covers all the vessels which are running along the coronary groove. The aortic arch gives out the brachiocephalic trunk, which is also present in all the species. However, the bovine heart it also contains the left azygous vein, which is unique to the bovine and the ovine, and absent in the equine and the canine. Moving on to the canine. The canine is ovoid and contains little or no fat. The aortic arch, it gives out the brachiocephalic artery and the left subclavian artery. Moving on to the equine heart. The equine heart is relatively big as compared to the bovine, and the coronary and the interventricular groove, they contain relatively less fat as compared to the bovine. All in all, this is the equine horses, bovine cattle, ovine sheep, canine dogs.
So for our second example, we have Kayla, who will be giving us an overview of kidneys from different species.
So here we have kidneys from the bovine, ovine, canine and equine species. And it's important to be able to identify and differentiate which kidneys belong to which species. This can be done using certain appearance-based hints. So we'll start off with the bovine kidney. As you can tell, it has a very lobulated structure and it almost likens to a raspberry. Next we have the ovine and the canine kidneys. These are a lot smaller and bean-shaped. The canine kidney is a lot smaller and bean-shaped, and this is what a regular canine kidney looks like. And it's important to be able to identify and differentiate what the regular looks like to be able to understand and differentiate what the irregular looks like. Last but not least, we have the equine kidneys, which are a lot more complex than the past couple of kidneys. This is due to the fact that they are very asymmetrical in nature. So on the right-hand side, the equine kidney is shaped like a heart, as you can see here. And on the left-hand side, the equine kidney is a lot more pyramidal in shape.
For our third and final example, we have Leishan, who will be giving us an overview of the canine uterus.
We have two examples of the canine uterus, a normal one and one presenting with an abnormality. We'll first take a look at the normal canine uterus. We have your vulva, vestibulum, vagina, cervix, uterine body, uterine horn, and ovary. You can also see the broad ligament present and the bladder. At the vagina-vestibular junction, a hymen forms, and this is a site for potential infection. In terms of fertilization, majority of the action takes place in your uterine horn. This is where the sperm will fertilize the egg. It will form a zygote and eventually develop into a fetus. Once the fetuses are fully developed, the mom will give birth to a litter of puppies. Now that we've identified the normal, we can move on to the abnormal. This is a uterus showing signs of pyometra. During the normal estrous cycle, there's fluctuations of hormones which causes thickening of your endometrium. With excessive thickening, there's excessive tissue, and this is a site for potential bacterial infection. The infection is usually so bad that the animal shows systemic signs, meaning that signs of illness can be seen throughout the body.
That was an amazing video. I hope most of you at home enjoyed watching that. And for the ones who are here, we actually have our beagles. So here at OP campus, we do most of our training for dogs and companion animals on beagles. So whichever training that we do, whether it's procedures such as preparing for administering medication or restraining or handling animals, we do it on our beagles. And the reason why they're there is so that they help us with that. And you can ask yourself, why beagles? Because it could be any other breed, but beagles have a fairly okay temperament and they have wonderful personalities as well. And because of their size, most people who are afraid of dogs end up being able to work on them with having the confidence to come and approach them. So beagles are chosen because they are a loving breed and they're more loving. So students feel more comfortable working with them, and that's why we have them here. So I'm with my vet student here, Sarah. So this is what actually a veterinary team would look like. So you will have your vet and you have your veterinary nurse, and they'll be working together, assisting each other with different procedures. And we're going to show you one of the different procedures, and you will see, or you will note, all of us have different roles that we play and responsibilities. So as the nurse, I'll be restraining the patient and making sure that Sarabi here doesn't fall off of the table, and making sure that she's properly restrained for whatever that Sarah needs to do. So we're going to show you some of the procedures. What do we start with? Okay. So the first procedure is how we would put on a cephalic IV catheter. So a catheter is very important when you're working with patients, because when you have a catheter inside, you're able to administer medication, whether it's saline or you have to put medication that has to go IV. You don't have to look for the vein every single time. So when a patient is going to be at the hospital for a reasonable amount of time, we usually start with putting in an IV catheter. And how we do that is we're going to show you. So first, I'm going to make sure that the patient is restrained. Please hold the mic for me. So the patient has to be restrained in a way where Sarah can go for the dog's legs. And then how you do it is the nurse has to make sure that the dog's head is close to your chest. That way she cannot move or do anything, even if she may want to bite or whatever. So you don't have to do it as firm. You just have to make sure the head is close to you. You can also pet the patient while you're doing that, making sure that they're calm. And then I will raise the front leg.
And then I have clear access to the cephalic vein, which is in this thoracic limb. And I can insert my IV catheter into the cephalic vein.
Also known as a drip.
Hi. So I'm going to show you different ways to restrain your patients on the table. So Sarabi is being very good by sitting here, but if we have her sit like this, to put her into sternal recumbency, we can lean over her and push her down like that. Good girl. And then if they are standing and you want to put them into lateral recumbency, you lean over them, and from the inside you grab, careless Sarabi, she's being very, very, very compliant today. You would grab her two limbs here, and then gently put her down on the table there, and then you've got her in lateral recumbency.
And for lateral recumbency, sometimes you may have to be working on the patient, and you want them to be in different positions to do any kind of examination, or if you want to feel for the heart rate, or you want to palpate, or you want to check the abdomen for whatever, you can have them in lateral recumbency, or you can also have them in dorsal recumbency, which is when the entire back is on the floor. And for that, it's sometimes done for procedures that you work on the abdomen, or when you have to do RADs, which is x-rays. We also have them in different positions such as those.
Okay, now we need 2 volunteers to learn how to do it for themselves. So, hands up, volunteers.
Your hand shot up first, so you can come up.
Oh, yeah. There'll be other opportunities too, so this is just the first round.
You can do sternal recumbency, so that's when.
That was really good.
Round of applause.
And then also it's very good to give them treats while you are doing any sort of procedures, because that also helps them with having a pleasant feeling with whatever is being done. So if you also want your dog or your pet at home to get used to vet visits, so you can try these procedures and making sure that you give them treats. So eventually when the vet does this, they have a pleasant association with whatever is being done to them. So it's always good to have treats and make sure that the patient is relaxed and comfortable. As you can see with Sarabi, she's very relaxed, inquisitive, looking at everyone. So you can tell she's not stressed at all, she's not worried. So you want your patients to be as stress-free as you possibly can. Do you have two procedures? You have two more procedures that they can do.
So we're going to give Sarabi a little break now. So the next beagle we have is Sherlock.
I'm also, when you're picking up your patient, there's a way that you do it, which also is supposed to help you with your back. So as vet nurses and vets, you're going to be picking up a lot of animals, and if you do it incorrectly, you're going to hurt your back as the years go. So there's a certain way where you carry your patient, and how you do it is, you make sure that you have one hand over the front part, and then the back legs, and then you have it close to your body. That way you can use your legs to support, and then when you're putting them down, you also don't bend because it's bad for your back, so you just go down, and then put them on the floor. Yeah, lift with your legs, not your back. So now we're gonna have Sherlock for the second demonstration. So also, it's also good to not do procedures for a very long time. So we end up having to switch between beagles, even when we're training with our beagles, so as to not have one beagle do 50 students for one procedure. They can also get tired of doing that. So it's also good to have different dogs who are helping us with different procedures.
So next we're going to show you in person how to measure the heart rate of Sherlock. So because the valve that makes the loudest sound is the mitral valve, and that you can hear more on the left side of the animal. So when we take heart rate, we preferably take it on the left side so that we have the best chance of hearing it. So you're going to find the fourth intercostal space, which means the fourth space between the two of the ribs. And you're going to start at the level of the elbow. So his elbow's there. So I'm going to start listening round about there. And then I'm just going to move my stethoscope around until I can hear the heartbeat as loud as possible. And then I can look at my watch and take his heart rate. So I found the points of maximal intensity round about there. So can we have a volunteer to, you can come up. Excellent. Well done. Nice. You can give her a treat. Sorry.
Okay. So I'm going to do some basic training techniques with you. And the first one that I'd like to do is simply how to greet a dog. Because many of us have had that experience when we get a young puppy or even an older dog, and we're getting home from work or we're getting home from school, and the dog just runs up and jumps up at us and gets so excited to see us, and sometimes they even urinate a bit on themselves, on you, on the couch. Or you might have a dog that's really very friendly to visitors at your house, and the dog keeps jumping up on your visitors, and some visitors don't like that. So I'd like to show you how you can train a dog not to jump up at visitors and just to be a bit more relaxed when you're getting home for the first time. So I'm going to see if Sherlock is going to misbehave for me. Come. Okay, so I'm just using treats to make him a little bit more interested in me than he normally would be. And when your dog does this as you get home, what you need to do is not go, "Oh, Sherlock, I love you," and give him all the attention in the world and give him a treat, because if you do that, you reinforce this behavior that you don't like. So what we actually want to do, okay, now he's really excited, is when he gets excited, we very calmly, restfully turn our bodies away from him, break eye contact with him until he calms down. So basically, we ignore him. And once he's calmed down, then we can give him a treat. And by doing so, we also reward the positive behavior, so the behavior of being calm. So he's nice and calm now. Good boy. And that's how we want to train our dogs not to jump up at guests. So does anyone want to try? It's an easy one. I think you yeah, thanks sit on here. Okay, so he's already interested in the treats. Okay, but don't look at him. Turn your whole body away from him. Now he's a bit more quiet. Now you can give him a treat. And that's how we train our dogs not to jump up at our guests and give them a fright. All right, we're also going to quickly look at how to train a dog to sit, if we have time. We don't have time. All right, so we're very quickly going to train a dog how to sit. Who wants to help me? Sit myself. All right, so the way that we start off, Sherlock here is already very well trained. See, he's already doing it immediately because he's smelling the treat in my hand. But with the new dog who hasn't been trained, we're going to get the dog's attention. Sherlock. And we're going to take the treat and we're going to hold it over his nose quickly. All right. And at the moment when he sits, we're going to give him the treat. But Sherlock here has been trained, so he already knows to sit in anticipation. There we go. So we're lifting the treat over his nose and over his eyes so that he looks up at the treat and it forces him to sit down. And the moment that his bum touches the floor, we give him the treat. And then once we've done that for a while and he knows how to sit, like he does now, we can start using verbal commands as we're doing it. So I can say to him, sit, and practice that. Eventually, he's going to learn to associate the word sit with treats. Sherlock, sit. Good boy. And then we can start fading the lure, so we can stop giving him treats every time he responds to us, like now. Otherwise, he'd gain a lot of weight. So can we have 2 quick volunteers to do sit? It's also really important to talk to your animals while you're training them. So I love talking to my animals in Afrikaans. So if they're doing really well, I'll say, "Oh, Leafy, who's your good dog?" Because that positive vocal reinforcement is also a reward for dogs. And it helps you to communicate with them without using treats. Okay, we're going to ask our volunteer to ask Sarabi. Sarabi, come. Okay, so reflexes are really important. All right, thank you. So thanks to our volunteers. And thanks to Sarabi and Sherlock. Can we give them a round of applause too?
Hi, I'm Tumelo Mutokwa, the Community Engagement Representative for OPVSC 2023. Did you know that the OP Veterinary Campus has a state-of-the-art clinical skills lab, which was established with the aim of creating a stress-free learning environment where veterinary nursing and veterinary students can practice their clinical skills? The next video presented by Leonie will explain further on what this facility has to offer.
The purpose of our skills lab is to allow us to practice our techniques on training models before we do them on live animals. This gives us some added confidence and competence when doing the procedures on live animals and reduces the risk of harming the live animals.
This is the haptic cow model. It is the most high-tech model that we have in the skills lab at Onderstepoort. And I'm going to demonstrate how this works. So first of all, I start by putting a rubber thimble on my finger, and then I insert my hand into the model, and on the inside there's a device that I have to connect my finger to that will control the movement of my hand. so that it will train me how to palpate, how to do a rectal palpation on a horse or on a cow. And then on the computer, I've got different settings and different options. Let's start with a haptic cow. So the first thing that I'm going to do, as you can see on the screen of the computer, is that the computer will teach me where to find the edges of the pelvis in a cow. And there my finger goes over the brim of the pelvis into the abdomen. And you can see how the computer controls my hand, so it stops me when I try to get too far, and it shows me where are the edges of the pelvis that I can palpate. Palpate means I can feel with my hand inside the animal. And then I go to the next level here, which is the cervix, the start of the female reproductive tract. And now the machine will guide my hand and will teach me where the cervix is in relation to the pelvis of the animal, so that I can feel. And when I go to a real animal, I've already familiarized myself with where to find the structures. And so we can carry on and we can simulate many different things like disease conditions. There's an example of endometritis, which is a disease condition that cows get after calving sometimes. And I can feel what that should feel like. And also pregnancy diagnosis, or finding the ovaries, many other settings that we can do here.
We've got various training facilities. Here we have students practicing suturing. These are our horse aging models. Here we learn to identify the age of a horse by looking at the teeth. We've got additional facilities that we use to further our studies. This facility has preparation tables for drawing up injection, sperm collection, a bull for injection sites and intubation, cats for diagnosing hydrothorax and performing thoracocentesis, a cow for practicing epidurals, and a table with some surgical equipment to practice with. This is our clinical pathology room in the skills lab. This facility includes X-rays, hematology, bandaging, body condition scoring, placing IV catheters, and urinalysis.
Good morning, everybody. Sorry, let's get these in the right place. My name is Dr. Kate May, and I'm actually from the Skills Lab. That's where I'm from. Let's get this calf in the right position. So, as you can see, we have a very well-equipped Skills Lab. Just put this calf in the right position. If you're wondering, this is a live weight calf. So, has anybody got cows here? Anybody from a farming background? A couple of you guys? Okay, cool. So, I'm sure that you know that veterinarians and veterinary nurses are involved a lot in calvings and lambings and kiddings. I'm not kidding, that's really what it's called when goats give birth. And whelpings, which is when dogs give birth. So we're involved in a whole lot of those things. And the whole point of having our skills lab is that so students can practice some of these things before they're presented with the real thing. Okay, so have any of you guys with cows or sheep, have you guys had to help pull out lambs and calves? Yeah, well, okay. So it can sometimes be a bit tricky, okay, because if the cow is not managing on her own, that usually means there's a problem. And the lovely thing about us having our skills lab is that students can practice all of this stuff without there being any danger to any of the animals. Okay, so the whole point of us having our skills lab was that we're having increasing student numbers, and obviously we have a finite number of live animals. You saw some of our beagles there. We also have cows, and we also have horses. We don't have any chickens. We have some pigs as well, and we have sheep and goats. But obviously we want our students to be quite good at what they're doing before we let them loose on the live animals. Okay, so today I'm going to talk a little bit about calving. This is what I call the diving position. Okay, so most of our animals are born in the diving position. So feet first and their nose on top, little head on top. How are humans born? Head first. Okay, that freaks me out completely. You'll see the whole reason we want to do veterinary is because people are gross. Like, we don't want to do people. Okay, so that's why we want to do animals. So all animals should be in the diving position, but sometimes they don't read the manual and they come with a shoulder flexion or a neck flexion. Okay, sometimes they can come bum first or back feet first. And probably the most important thing for us to figure out is, are they coming forwards or backwards? Okay, so obviously if the head is there, it's really easy to tell. Okay, I've got a head there, that's easy. Because remember that this is all happening without you being able to see what's happening. Okay, this is inside the cow a lot of the time, or the sheep, or whatever it is. So we need to identify, is this the head of the animal, or is it the bum end of the animal? And obviously the tail's there, which is quite a giveaway that it's coming backwards. Okay, but what if you've got a neck flexion? So what if the neck is out the way and all that we've got is the front legs? How do I know that these are front legs and not back legs? Anybody thought about that? So yeah, the soles of the feet are usually facing down, okay, if it's a front leg and they're coming like this, but they could be coming on their backs. Okay, so it's not always. The trick is to see which limbs or which joints bend. And in the front leg, the fetlock and the carpus or the knee bend the same way. Okay, so if we bend the two first joints that we come across and they bend the same way, we know front leg. Okay, in the back leg, the fetlock and the tarsus, which is this joint or the hock joint. Any horsey people around here? The hock joint, okay, it bends the opposite way. Okay, so then we know we're dealing with something that's coming backwards. All right, so we've established that it's forwards or it's backwards, and that's going to dictate a little bit about what we do. Okay, so when you're doing with a calving, and the fancy term for that, or the veterinary term for that, is a dystocia. Okay, so euto here means that it's coming normally, okay, and dys means dys is not right or abnormal, and to here is birth. Okay, so it's something's going wrong with the birth. So when we are called to deal with a dystocia, then we need to work out what we need to do. Okay, so has anyone got a pen on them? Sorry, should have brought a pen. Thanks very much. Sorry. Okay, so one of the coolest things that I learned, I think, in veterinary, which was many years ago now, was that you can use a normal ski rope, okay, that you buy from Builders or Chamberlain's or wherever your shop of choice is, that you can make this into a really useful calving rope. Okay, now we don't want to make knots in the vagina, okay, and you'll see in veterinary we talk about vaginas and penises all the time. It's completely normal, okay, for us. But we don't want knots and things in the vagina because that will cause damage and bruising and obviously be quite painful for the female. Okay, so we want to make a slip knot, but we don't want one with a big knot in it. Okay, so what we do is we take a normal ski rope, and if you just do it like this, you stick your pin in the middle, okay, and then you can point your loose piece of rope down the middle there. Okay, make sure it's nicely secure. Okay, and that makes a really strong loop, okay, without any knots. Okay, and then what we can do is make a very nice loop, which we can then manage from the outside, and we can put over the limbs that we need to manage. Okay, so if we're doing a calving or a lambing, we're going to have our rope. We're going to put that over the fetlock, okay, which is sort of the first very bendable joint. And then we're going to do something called a half hitch. So your hand on the rope, you're going to just turn your hand over, okay, and then put your rope below the fetlock. Okay, so we've got a piece of rope above and a piece of rope below the fetlock. I don't know if you guys can see down there. Can you guys see? Okay, so above and below. And the reason that we spread the load, we spread the pressure on this joint, is that we're going to put quite a lot of pressure when we're trying to pull this calf out, and we don't want to just have one loop. Then you need to use your rope handles. Okay, and these are basically a broom handle that's been cut. Okay, often in veterinary you have to make plans. Okay, you get to a farm and you're like, oh dear, I forgot the ropes at the practice. And then baling twine is very useful. Okay, you can really make a plan in veterinary, and that's sort of one of the skills that you have to develop as a veterinarian. So we're going to put this rope on. Okay, so again we're going to bend our hand over. We're going to pick up the little piece of rope there. It's also called a half hitch. And then we're going to have a very nice rope that we can pull. Am I still on camera here? Okay. And the nice thing about this is that it's quick release. Okay, so it's going to disappear as soon as you get rid of it. Right. Now, calves like to get stuck. Where do you think are the most common areas where they're going to get stuck? Michael at the back. The pelvis, okay, so the hips are going to get stuck. That's a big area of it. Anybody else? Was there a question? No? And the shoulders. Those are the two places that they're going to get stuck. Okay, so when we are doing our carving, we always need to have 3 points of contact. So I'm quickly going to put ropes on the other side here. Okay, again above and below the fetlock. Okay. And then we need to also control the head, because otherwise every time you pull the legs, the head goes backwards. Okay, so we have a nice piece of equipment here called a head snare. Okay, ours has seen better days. So the head snare is a nice piece of equipment that we're going to use to go over the head. Okay, so basically we're going to go behind the ears and then in the mouth. All right, why don't we put it around the whole neck like this? Okay, good guys, well done. Okay, so we just put it in the mouth like so. And then you as a veterinarian are going to be controlling the head. Okay, luckily on most farms in South Africa, we've got a lot of help. Okay, so you don't have to be the only person pulling this calf out. You're going to have 2 other strong men, generally, to help pull a calf out. Okay, if you forget your head snare at home, don't despair. Okay, you can quickly make another loop with your rope. Yep, right on the farm there, quick sticks. Okay, and you can make what's called a war bridle. Okay, which is basically a head snare with a piece of rope. Okay, so above, behind the ears, and then in the mouth. Okay, and then how do you think we're going to get these shoulders out? How are we going to get these shoulders out and not get them stuck? Any thoughts? Not you vets, guys. Okay, so we're going to walk the calf out, basically. So we're going to use what we call alternative traction. So we're going to get people pulling the right leg to pull, and then the left leg to pull. Okay, so we basically walk that calf out. All right. So the other thing you need to use when you're doing a carving is lots and lots of lube. Okay, let's never underestimate how much lube you need when you're carving. And then we can walk the calf out. Okay. The other part that is going to get stuck is going to be the hips. Okay, so let's pull. Can I have 2 volunteers to help me with this? 1, 2. I think, have you done something before? Okay, I think the person next to you then. Okay, sorry. You're too quick on the arms up there. Okay. Okay, so let's get you another rope handle here. So, there we go. Okay, that's your one. And this is your one. I'm going to be in charge of the head here. Okay, guys, let's start pulling. So left person pull first. Okay, and then the right person, and then the left person, the right person, left, right. Okay, now, if this is our cow, okay, we're going to get to the hip part, which is where they're going to get stuck. Okay, so to stop the hips getting stuck, we need to get one hip in, and then the other hip in. Okay, and then we can pull it straight. So you're going to get your 2 helpers to go that way, almost perpendicular to the cow. So both of you go that way, please, both of you. So we're going to pop the one hip in, pop, and then we're going to get them all to go this way. Okay, see why you have to be so strong and fit when you're a veterinarian. Other leg in, okay, and then we can straighten them up. Thanks, guys. Sorry, there's a big table in the way there. Okay, and then we'll be able to pull the calf out. Okay, do you guys want to feel how much a calf weighs? Yeah. You can just put your thing down there. There we go. Don't go, we'll get you quite heavy, eh? Surprising. So you need to catch that calf when it comes out. Okay, do not let it hit the ground. Wow, you're strong, man. Okay. All right, thanks very much, everybody. Okay, what questions have you guys got about giving birth? Question at the back there. Sorry. Just getting you a mic.
Aren't there any other difficulties once you take it out?
Well, the next thing, so obviously now we've got two patients. We've got our new patient, okay, which is our neonate, or our calf, and then we've also got the cow. So we obviously need to make sure that it can breathe nicely, okay? So we've got to make sure all the membranes and fluids are wiped away from the front of the cow. So that's why you have to be prepared, okay? So when you go into a calving, you obviously need all your calving ropes and everything, but you also need to have blankets or towels generally. We use a lot of towels in veterinary. And you need to have any other equipment that you might need to resuscitate the calf. Okay, so we'd obviously want to clean the nose and mouth, make sure there's no fluid in there, rubbing the thorax or the chest of the animal to make sure that it stimulates breathing. Okay, we want to make sure that they're not in a draft, somewhere cold. Obviously, we want to make sure they're not in mud or anything like that. Generally, cows are pretty good about looking after their new babies. So once you make sure that it's breathing nicely, you can also tickle its nose with a little bit of straw, make sure it's breathing nicely. Don't throw cold water or anything on it, because obviously we don't want to chill a little neonate. Okay, they just come out of a really nice warm environment, and now we don't like throw water on them or anything like that. Sometimes you see people hanging them upside down. I don't know if anybody's seen that. Okay, you don't need to hang them upside down. You're actually putting a lot of pressure on their lungs if you hang them upside down. My sort of theory is that if you've never seen a cow hang a calf upside down, then you probably don't need to do it either. Okay, that's kind of the ethos we use. So yeah, cleaning the nose and mouth, and then just taking the calf around to the front of the cow. She will lick it, she will bond with it, and then you can just check the back end of the cow to make sure if there's any problems, which I'll talk about in a second. Does that answer your question?
No. Then how do you, if it has mucus in it?
So how do you?
So if it has mucus,
yes,
like trapped mucus, how do you take it out?
So generally with a calf, I mean, you know, things have been giving birth for millions of years successfully without our interference. So just wiping it with a towel. Usually they'll sneeze and get rid of all the mucus. And there's all kinds of things that happen in the lungs. There's difference in osmotic pressure and everything. So any fluid in the lungs gets absorbed. So remember that in utero, inside the cow or whatever animal, the lungs are not developed. So they still have to develop once the animal comes out and starts breathing air. So there's all kinds of mechanisms in place that kick in as it starts to breathe air. So yeah. Okay, so you just need to clean it out with a towel gently. Any other questions? There's one here.
Why do some cows come out with a yellow stain on them?
That's a great question. Okay, so in utero, everyone happy with in utero? So inside the cow or inside whatever animal it is, there's a couple of sacs. So there's a sac around the calf. We'll use calf as an example, called the amnion, okay, or amniotic fluid. I don't know if anyone's, probably you guys have done this. Okay, the amniotic fluid is really important for the cows, or any animal actually, to swallow. We swallow our amniotic fluid, and that helps our gut development. And when it passes through the gut, it becomes what's called meconium at the end. Okay, so I don't know if anyone's seen a new baby or puppies or whatever, new thing. There's often like a very yellowish, sticky poo that comes out afterwards. Like the first poo is always this yellowish, sticky stuff. Okay, that's meconium. That's actually from swallowing the amniotic fluid. So when animals get very stressed in utero, okay, so things that stress calves or puppies in utero is not things like exams, obviously, or taxis or load shedding. It's running out of oxygen, basically. Okay, so if the cow is calving and there's a lot of pressure on the placenta and the placenta is starting to detach or anything, or the umbilicus is being compressed for whatever reason. So the umbilicus is obviously where the big blood vessels run into the fetus. And sometimes when animals are coming backwards, the umbilicus gets stuck on the pelvis, so it gets compressed a little bit. So any kind of thing like hypoxia, so running out of low oxygen, stresses these fetuses, and they actually poo, and that is what stains them yellow. So if you see a yellow staining after birth, it means that animal was very stressed in utero. Okay, so that's important. The things that are really important to remember, how's my time? Am I still okay? Still fine, okay. Other things to remember with newborns is that if there has been a dystocia, so if it's been a difficult birth, they might be a little bit slow to stand up, okay? And they might be a little bit slow to suckle, all right? And what do you guys know? Maybe you guys don't know, but with ruminants, so everyone know what I mean by ruminant? So sheep, cows, goats are all ruminants, okay? And also horses. The type of placenta they have is is very superficial, okay? So there's no transfer of antibodies across that placenta. So it means that it's absolutely imperative, it's so important that these foals or calves or kids or lambs get colostrum. Okay, does everyone know what colostrum is? So colostrum is that first milk, okay, and that first milk is full of antibodies from the mother that gets transferred to the offspring, okay. And they have to drink that milk, that colostrum, in order to get their own antibodies, okay. And the ruminants and horses have developed so much that in the first 24 hours after birth, the gut is very leaky. So those antibodies, which are quite big protein molecules, can actually move into the bloodstream of the animal. Okay, so that actually gives, it's called acquired immunity. So they actually get immunity from their moms. But the downside is if they don't get that immunity, they don't get that colostrum within the first 12 to 24 hours, then they have absolutely no immunity. Okay, they're completely immunocompromised, which means that pretty much anything's going to kill them. Okay, so that is why it's absolutely important that the animals get that colostrum. Right, I think there's a question in the back, and then I'll come to you. Yeah? Sorry, this is turning into a reproduction lecture.
Can you make like artificial colostrum?
That's a really good question. I think, so the best colostrum is definitely from the mom, because the mom has been in that environment, she's had that exposure to any bacteria or viruses in that environment, so she has the correct immunity for that thing. In foals, there is sort of a powdered colostrum that you can have, but there's actually nothing to replace a mom's colostrum. The nice thing is that you can milk out colostrum from a cow or a sheep that's just calved or lambed, or kidded, a goat, and you can actually freeze that colostrum and keep it for up to a year and then defrost it if you have a calf that's not, let's say something's happened to the mom, and then you can actually bottle feed that one with the colostrum. Okay, so that's a really useful thing. Also do it for foals as well, but it's much harder to milk out a mare. Cows are much easier. Does that answer your question?
My question is related to what you asked.
Related, so can you have, yeah. So as I said, colostrum is, the best thing is to have either from the farm. So if anybody from a dairy here? Any dairy people? So if you're from a dairy, they often have a colostrum bank. So they'll have frozen colostrum that they can defrost if the need requires. Okay, just don't heat it up in the microwave, okay, because that destroys all the proteins. So, okay, just warm it up with warm water. The question in the back.
Hi, I have a question. So during, let's say, a difficult birth, whereby the cow and the calf are both in critical condition, which one do you save first?
That's a really good question. Most farmers would want you to save the cow, because the cow can go on to have more babies. Yeah. Obviously, these days, I'm not sure if anybody's involved in this, but we have a lot more what we call assisted reproduction in our farm animals. So obviously in people, we've got IVF, we've got surrogates. You hear Janet Jackson's having a baby at 50. You know, we don't obviously do that with our cows, but we can do, we can super ovulate our animals, and we can do embryo transfer. Okay, so we can, let's say we've got a super cow, amazing milk producer, we can get a whole lot of embryos from her, and we can put that into a whole lot of surrogates, okay, and have embryo transfer calves. You can also do that with horses. Let's say it's a competition mare, okay, she's a great competition mare. We don't want her to stop her competition career. We could get embryos from her and put those into donors. So often then the value of the individual foal or calf is much higher. So then it is a sort of a cost benefits. So let's say it's just the calf has been very expensive. It's an embryo transfer calf. It's from very, very good genetics. They've paid a lot of money for this calf. They might want you to save the calf. So you have to, again, get the owner's input on that. Okay, so any other questions there? Okay, how much longer have I got? 5 minutes. I can go on. Okay. I just want to show you guys a nice, easy knot to learn. So it's really important that when you are working with animals that you can get them undone really easily. Okay, so I think the horsey people know this. Your horses, you know, there's a plastic bag that flies past. The horse completely freaks out and fights the rope and hurts themselves. Okay, horses try and hurt themselves a lot, generally in my experience. But equally, if you're tying up, obviously we don't tie up cows that often, but if it's a very tame cow, we might tie her up. So any animal that you're tying up, you need to be able to tie a quick release knot. Okay, so that's one of the things that I really would encourage you guys to learn when you are, before you become a veterinarian, ideally. Okay, so I don't know if you guys can see, what can I use here? Okay, I'm going to use this, pretend this leg is a post. Okay, so it's a really good idea to have, as I said, a quick release knot. So just one that I'm going to show you is you keep the short end of your rope in your dominant hand. So I don't know who's dominant hands here. I'm right-handed. Okay, then you cross the rope, okay, over the long side, and then you make a little loop in that rope. Okay, and then you pull the little tail of the rope, and I'll come and show you guys just now, through that rope. Okay, so it actually makes a slip knot. Okay, you guys can see there, which we can then tie to, this is obviously tied to the cow or to the horse, and then if anything happens, we can quickly release that knot. Okay, so it's what we call a quick release knot. So that's a really useful knot to know. Sometimes we need to lift a leg of a calf up or a cow up, okay, because cows can get a lot of claw trouble. Okay, so obviously we don't call it hooves in horses. In cows we call them claws. So if you have to examine a claw, you need to basically, you can use the same knot to lift up the leg and then tie that to the crush, for example. Also, what's quite useful to learn is something called the bowline. Are there any mountain climbers here? We need Boy Scouts, Girl Scouts. Okay, it's quite a big thing I'm showing my age here. Okay, so the bowline, because occasionally you'll be called to things like dog has fallen down mountainside, okay? And in the fire department, like, what are we going to do? Or calf has fallen into a manhole cover, okay? So what are we going to do? So we want a knot that is not going to tighten, but that we can actually get the animal out. Okay, so the bowline, I just want to see if I've got a longer piece of rope here. Any longer piece? No. Okay, can you guys still see me, Louis, here, if I'm standing here? You can, and we still got it. Okay, so the bowline, again, you keep the short side in your dominant hand. Okay, I'm just showing you around my waist. Then with the long side, you want to make a little loop. Okay, and this is called, so this is going to be the rabbit. Okay, this is obviously the rabbit's little hole. And you're going to get the little rabbit to come out its little hole, round the tree, okay, and then back in its little hole. All right, so we basically form a knot that looks like that. Okay, so that's called a bowline. I should have asked any sailors, okay, because sailors also know how to do a bowline. All right, so the bowline is a very nice knot because it means that it's not going to get tightened, unlike that quick release knot that I showed you. So if you need to get pulled, if you guys need to get pulled up a mountain, okay, the bowline is a really useful knot to know. So you can tie this around an animal, and you can rescue them like that without it getting tighter as you're pulling. Okay, I'm just going to show you another use for the bowline. Let me just get this calf in the right position. Is that you can use it as a temporary halter. Okay, let's get this calf. Sorry, it does make weird breathing noises as well. So let's say we get to a farm and we need to have a halter for whatever reason. You've left your halter back at home and now you need to halter your horse. So again, we're going to use the bowline. So we're going to go over the animal's neck. Okay. Short side there. Okay. So we're going to make our little loop. Little bunny goes out the hole, around the thing, back through the loop there. So we've got a very nice bowline. So now we've got a non-slip knot around the neck of the animal because we don't want that one to get tighter. Okay, then what we can do is just take our other piece of rope through that loop that we've made, put it around the nose of the animal, okay, and then we have a very nice temporary halter that we can lead the animal, okay, and it puts pressure on the nose of the animal but not the neck of the animal, okay. In cows, what we need to do is actually put an extra little loop in there, so otherwise it goes up into their eyes. Okay, so you can see there's often a bit of a species difference in the different animals. Sorry, I don't know if you guys could see that. Okay, so yeah, it's quite useful to have a few like good knots up your sleeves. Okay, and we obviously do teach you guys how to do those things. Okay, any questions? That? Oh.
I actually have a question about resorption and aborting with cows, because we went to a farm to do the pregnancies to check them how many months, and then we were talking about it, but I still don't understand it quite.
Yes, so there's a lot of things, that's quite a broad topic, there's a lot of things that can cause abortion or early embryonic death. In the different species. So obviously we have some venereal diseases, so some sexually transmitted diseases in animals that can cause what we call early embryonic death, so in the first sort of 48 days of pregnancy in our large animals. So things like Trichomonas or Campylobacter, I don't know if you guys are used to those terms, those can cause early embryonic death. And then obviously the cow, if she's still infected, she may not reconceive. Okay, so those are big, what we call production diseases. They can cause a huge loss in a breeding season for a farmer. Did they have, was it just a few abortions or? Two. Okay, so we do say that about 5% of pregnancy loss is considered normal. Okay, so let's say you've got a herd of 100 animals, 2 of those aborting or not conceiving would be normal. We wouldn't want to keep those in the herd often if they didn't conceive. Then in terms of abortion, again, there's lots of stuff out there. I think you guys know there's bacteria, viruses, fungi, prions, there's all kinds of weird and wonderful things. And you can also get a lot of things that can cause abortion. So things like viruses, so you might hear about, and some viruses or some bacteria are what we call zoonotic. Have you guys heard that term before? So zoonotic means that it can transfer from animals to people. Okay, so there was a big question about COVID-19. Is that zoonotic? Okay, I don't know what the latest thing is. I think it escaped from a lab apparently, but anyway, that's just what I heard. But for instance, SARS a few years ago was, I think, was zoonotic. Swine flu, okay, bird flu, those are all zoonoses. Those are all things that transfer from animals to people. And it's obviously something that you need to be quite careful of when you're dealing with animals because some things are zoonotic. Things like Rift Valley fever, for example, is zoonotic. So you can get a lot of viruses that can cause abortion. And if a virus affects a pregnant animal, it depends on what stage of pregnancy the virus affects the animal. If it's very early on, you might get resorption. If it's quite late on, you might get abortion. Okay? If it's anywhere in between, you can sometimes get weird and wonderful, what we call fetal monsters. Okay? So you hear about the two-headed calf, or the cyclops, or the calf with 6 legs. Okay, that's a little bit different. But those are often because of a viral disease during pregnancy. Okay, so they are still normal. They're just, something went wrong in utero. Certain toxic plants can also cause weird and wonderful things to happen to the fetuses in utero. So obviously you guys do toxicology, so you know which plants are poisonous. So certain bacteria can also cause abortion, so stuff like Brucella. Brucella is also a zoonotic, okay? So that can also affect people. That is one of the occupational hazards of being a veterinarian, all these zoonotic things. Sheep that are aborting, it's often zoonotic. It can be Schmallenberg disease, Sprerenberg virus, or blue tongue. That's not zoonotic, but it can be all kinds of things. Equally, anything that affects the health of the dam, so the dam is the mother, while she's pregnant, can cause abortion. So stuff like babesiosis or tick bite fever. If she has a temperature reaction, that can also cause abortion. So there's a whole lot of stuff that can happen. So it's often very difficult to diagnose one thing, because often they will abort and they would have been infected 2 months ago. So you never actually find out what happened. So yeah, great question. Sorry, big answer. Any other questions? So you might have picked up I'm a reproduction specialist by training, but now I do the clinical skills lab stuff.
When the calf is turned backward during birth, how do you go to work?
So animals can get born backwards. Just give these people a view of the backwards calf. So they can be born. They can be born backwards. You just have to make sure that the legs are in the right position. Okay, and then you also just put ropes on. Obviously, you can't have your 3 points of contact like you can with the head, because you don't put anything on the tail. And then also being careful to get one hip in first, and the other hip in, and then pulling straight. Okay. Sometimes we have a condition called breech. Okay, I don't know if any of you guys were breech babies, which means you're coming bum first. Okay, so that's obviously a little bit tricky. Okay, so again, it depends on how big it is. We would use lots and lots of lubrication. We would then try and get the legs out. Okay, so we get them into a tarsal flexion and then try and get them into an extended position like so. Okay, and obviously do the same for the other side. We can also do cesareans. Okay, so that might be an indication for doing a C-section on that animal. Yeah, if you struggle too much with trying to get the legs out. Yeah. If it's a small calf, you might manage. Sheep are really nice to do dystocias in, because they are really, they're quite small. Actually, the biggest problem that we get in sheep is that we actually, because they are what we call a polytocous species, so they are actually litter bearing. Okay, so you should have 2 or more fetuses. And the problem with those is that farmers will often say, oh, here's a leg and here's a leg, I'm going to pull, okay? But this leg belongs to one twin and this leg belongs to the other twin, okay? And then you jam them into the pelvis. So it's really important when you are dealing with, especially a small stock or pretty much any animal, that you make sure this leg belongs to this head, belongs to this leg before you pull out. Okay, so that is actually the thing that most causes dystocias in our small stock. Okay, I think I'm almost at time. Any last questions about anything? Yeah.
Birth after C-section?
Can
cows have a natural birth after C-section?
Yes, that's a great question. Yes, they can. So cows are incredibly tough, people. Incredibly tough. Okay. So usually in people, they don't like you to have a natural birth after C-section, but in cows, they can have natural birth. In certain breeds of dogs, anybody own a bulldog here? Okay. Bulldogs are the bane of veterinarians' existences, but we also make a lot of money off them because they have so many problems. Okay, they can't breathe, first of all. They also can't breed, so we have to breed them, and then they can't give birth. Okay, so then we have to do the cesarean. Should we be breeding bulldogs? Okay, these are some of the moral and ethical questions that we come across. Okay, apparently French bulldogs have just overtaken Labradors as the most common pet in America, so it's going to happen here as well. Does anyone know how much a French bulldog costs? About 35,000 Rand for one. Okay, so people are paying 35,000 Rand for a puppy. So often the breeders, you can imagine a pregnant Frenchie with 3 puppies inside her is worth sort of, my maths is not great, 120,000 Rand more. Okay, so these are some of the numbers that you're dealing with. So yeah, owners will often want you to do a cesarean with them. They can, touch wood, still give birth, but I think there's going to be a time when they're so inbred that they're not going to be able to give birth. Okay, but then again, we have to educate our population, well, our clients, and the general population about having dogs that can actually survive properly. So that's also something that we work on as veterinarians. Our job as educators is also very important as well. Okay, so thank you. Good question. Any other questions? Dog breeds. There's a question at the back there. Just tell me when I need to stop, Camilla. Just tell me when. Okay. Last question. Okay.
I wanted to ask, why can't bulldogs breed?
Breed? It's physics. The males can't get on and retrieve intromission. It's just physics. They're just not designed properly. Cool. Thanks, guys. You've been a great audience. I'm going to hand back over to the PBSC, to Pamela. Is that good? Thanks.
Thank you so much, Dr. Kent.
No problem. Take my cough.
I was having a little bit of PTSD because she's lecturing me for reproduction, so I have to do some studying. But for now, we're going to have Sarah, who's going to tell you about clubs and societies at OP. So even though we care about you guys studying and being the best that you can be, there's also clubs and societies and sports that we do here. And some of them are in line with what we do. Some of them are just completely different to what we do in the profession. But all of them are there so that they can help with your wellness and that you enjoy your educational journey here at OP. So, take it away.
Hi everybody, I'm Sarah Kilfoyle. I'm the Vice Chairperson of the OPVSC and I also hold the Club, Societies and Sports portfolio. So I'm just going to give you guys a bit of insight as to the clubs and societies that we offer here. Firstly, we aim to encourage the students to participate in the clubs and societies because veterinary and vet nursing, they're very stressful degrees and you can't just sit in your room all day and study and work, like you need to have a break. So at OP we have 16 societies that you can participate in. So the first one is the Beagle Interest Group. So you saw two of our beagles earlier. So we have quite a number of beagles at this campus. And yeah, so basically you can take the beagles for walks. You can participate in wash days where you sign up to wash the beagles and just have a fun session. You can sign up to train the beagles, work with them in the agility center that we have here. Yeah, it's really nice, like it's a nice break and there's specific routes that you can follow on campus where you can walk the beagles. So it's a very nice break to have. Okay, the next one is the Cat Interest Group. So with this society, you sign up and you have the opportunity to foster kittens. You can get kittens as young as a day old, where you have to bottle feed them, you have to stimulate them. It's a great like hands-on experience with the kittens, especially for those who haven't really had much of like a cat background. Like it's a really good way to get into that because obviously we will be working with cats in the future. Yeah, so you get, like I said, you get to practice bottle feeding and weaning, which is when you get them from milk to solid food. And then the next society is the IVSA. So this is the International Veterinary Student Association. Basically, students who sign up for this society, they get to build connections with veterinary students around the world. They also have the opportunities to sign up for like exchange programs. So currently this year they're going to Madrid. They're having an exchange program with the Madrid students. So yeah, it's a really great way to build connections, especially if you're wanting to move overseas and practice there. Like it's a good way to build connections. Okay, the next one is the OP Aquatics Club. We don't really get hands-on experience with aquatic animals, so this is a really nice society to sign up for if you're interested in the aquatic species. There are only, I think, 3 specialist vets in this field. They come and they have conferences or talks with you and they educate you more about the aquatic species. So it is very interesting to be a part of this club. They also go and do river cleanups where obviously they like help the environment and they're all about conservation as well. Okay, the next one is the OP Book Club. So students who sign up for this society, they get to nominate books and then based on the nominations, students can choose their favorite book and then there's a book that's allocated for the book of the month and then students will read it and then they'll come together and give an opinion, like a review of the book. Okay, then we have the Christian Fellowship Program. So this is for all students who practice the Christian religion. So you can come together and you worship. There are some camps that you can attend as well. Okay, then we also have the Exotics Club. So we also don't really get a lot of hands-on experience with exotics before clinics. So this is also a nice club to be a part of if you're wanting to get out of your comfort zone, if you're wanting to work with the snakes and spiders and those things. It's a really good experience, and they end up going to conservation areas as well, where they get to work with these animals. Okay, then we have the OP Production Animal Group. So with this society, they are focused on artificial inseminations of the ewes and the mares and the cows. And so students get hands-on experience with this as well if you sign up. So you get to get the semen collection, you get to actually physically do the artificial insemination. It's a really, really good experience. Okay, then we have the riding club. So you can sign up to be a part of the riding club, and then at the beginning of the year, after sign-ups have completed, you can apply for a grading course. So you can either initially say you're a beginner, then you don't have to worry about the grading course, or if you feel like you have experience with riding, then you take the grading course and they can see whether you're intermediate or advanced. And then the students who are classified as the advanced riders, they actually take the beginners 4 lessons. And then they also have the opportunity to go on outback rides around campus, and it's pretty cool. Okay, and then we have the OP Rock Climbing Club. So we have a few walls around OP where they are actually, they're allocated for rock climbing. So any of you guys who are in it for the adrenaline rush, it's a really nice club to be a part of, because you also go on excursions to mountainous areas, and you get to actually put your practice at work. So it's really cool. Okay, then we have SAIVA. So this is the South African Equine Veterinary Association. They are obviously involved with horses. They have conferences that students can attend. So this year, students actually went to KwaZulu-Natal to attend a conference with specialist vets, and they were also able to have hands-on experience with racehorses and kind of see what the behind the scenes look like and what they could potentially get themselves into. Okay, then we have the Small Animal Students Association. So as the name suggests, you work with the small animals, so the dogs and the cats. Mainly dogs at this stage, because OP, we don't have cats here. So it's a really nice experience, because you also get to attend dog shows, you get to listen to talks from various stakeholders. They're all very relevant to small animals, so it's also it's really nice if you wanted to get extra information, because they do pharmaceutical talks, they do general behavioral talks, so it's very informative. Okay, then we've got SIMCO. So this is the Wildlife Symposium. Students can sign up. It's actually recently been added to the societies list. So students can sign up, and then you basically get the opportunity of a lifetime where you can go on a trip. I think it's about 2 weeks long, and you get hands-on experience with wildlife animals. You work alongside specialist vets as well in the wildlife department. And it's also a great way to build bonds with international students, because they accept international students into the program. I think there's about 10 or 11 spots allocated specifically for them. So it's a really nice way of networking, and then also obviously getting to know your peers better as well. Okay, then we've got Vet Books for Africa. So this society, they travel, they raise funds. It's a non-profit organization. They raise funds, and then they travel to various countries in Africa, where they will donate textbooks, journals, veterinary equipment, and other veterinary-related products to the rural communities, as well as other veterinary universities in Africa. And it's just to kind of improve the education, and they also aim to help with conservation. So it is also, just like the Wildlife Symposium, it's also a once-in-a-lifetime opportunity, and you will be making a huge impact on the lives of the people that you meet. Okay, then we have VETSCO. So this is the Veterinary Student Community Outreach program. So you basically go on community outreaches where you get to have hands-on experience with vaccinating cattle and dogs, and you get to learn how to do basic clinical exams with these animals. You get to interact with owners. It's also a great way to get used to and comfortable with handling these species in a clinical environment. Okay, then we've got the wildlife group. So just like with the wildlife symposium, you also get hands-on experience with the wildlife animals, but it's not a specific group. It's not like where they go on one trip throughout the year, which is what the symposium is like. With the wildlife group, they have, I think it's about 3 excursions throughout the year that you can sign up for, and then you get to get hands-on experience with the wildlife species in that you get to practice dipping and darting the animals. And what's pretty cool is that with the darting, you actually go up in a helicopter with one of the vets, and then you practice darting from there. So it's a very, very cool opportunity. And once again, it's a great way for you to build connections with fellow students and just to improve your hands-on experience with wildlife, because it's also only in clinics where you really get that experience. Okay. Does anybody have any questions?
I wanted to ask, how many groups can you attend at a time? Can you sign up for?
Oh, how many societies can you sign up for? It's unlimited. It's basically, you can sign up for as many as you want, and then you'll get added to a WhatsApp group. And then if they send an announcement saying that they've got a certain event and you see that you can fit that into your schedule, then you just volunteer. So you can literally be a part of as many as you want. Anybody else?
So do all the groups require a joining fee or something like that?
No, so when you join these societies, it's free. With the horse riding, they do charge a fee. The last time I checked, it was 30 Rand per lesson that you pay the experienced riders. But all of the other societies are free. There are obviously some events that do require payments, but you can choose whether you want to pay that or not, depending on your financial status, obviously. So it's fully voluntary. Okay, does nobody else have any questions? Okay, then we're going to hand over to Prof. Hollum. He's going to do a Q&A session with you guys now.
Thank you. Okay, that's the last session now. That will be a talking session. So I'm going to sit down, that we can be a bit more informal. If you have any more questions about the admission process and selection processes and so on that you want to clarify. Oh, yes, let's start over there. The chair doesn't work. I'm going to move.
Prof, can you tell me more about the value-added form?
Yes, okay. So the value-added form has different components. There's one that is on your experience with animals, where you give some information of what experience that you've had, and where you give your reflections. So that's what we discussed a little bit yesterday as well, where you do a self-reflection about your experience with certain things that we ask you questions about. And then there's the section about shadowing, where, as we explained, the purpose is to allow you an opportunity to see what a veterinarian does in practice wherever they work, or a veterinary nurse. And that has to be specific for the profession that you are applying for. So if you're applying for veterinary nursing, shadowing with a veterinary nurse. If you're applying for veterinary science, shadowing with a veterinarian. And we would like to see that you have shadowed the professional in different types of practice. So for veterinarians, for instance, we would like to see that you've shadowed a private veterinarian in an urban type of practice, so with small animals mostly, and somebody working with horses, somebody working with production animals, with cattle and sheep and so on, and wildlife, and maybe even something like the SPCA, and different types of work environments. The more of the different types, the better. So you don't necessarily need to spend a lot of hours shadowing at the same place. It's for us more important that you shadow a diverse spectrum of the profession. And the reason for that is that we would like you to have a very good understanding of the different components of the profession that you are about to enter. And the second reason, as we explained yesterday, is it gives you a very good pre-learning, because you're going to start to see things there, although you don't yet understand how things work and why we do things in certain ways, you have context. So you have seen certain things in practice, and when we teach you about it at school, you can reflect back and, oh yes, I remember I've seen this situation, so I understand what the lecturer is talking about. And then the last section of the value-added form is on balanced lifestyle. So it's important to us, although we emphasize how much work it is academically, it's important to us that our students have a balanced lifestyle. We've just heard about all the clubs and societies. It's really important to the faculty that you also find time to relax, and that you are a person that will be holistically educated, that you can make a real contribution in the society where you're going to work one day. So for instance, leadership positions, involvement in clubs and societies, sports, all those things that make you a holistic person and not somebody who's just focusing on your studies. That is part of the balanced lifestyle. And for all these things, you can and you should submit evidence. So when you apply and the value-added form opens for you, there are certain sections that you have to complete in an online form, and then you can upload documents as evidence. For instance, with the shadowing, there's a form that you can download and print, and when you go to practice, you have it completed and signed by the veterinarian, and you upload that as part of your application. And the same for, let's say, leadership. Let's say you were a prefect at school. We do consider that as part of your value-added form, but you must give us evidence. So the school needs to write you a formal letter on a school letterhead that we can contact the school to verify. So it needs to be a formal letterhead, and you upload that as part. Usually the schools will do that for you, and they will include all the activities that you took part in on the same letter. So that's what the schools usually do. But some people are maybe part of junior city council, for instance, and other activities that are not part of school, extramural activities, sports, or other things, cultural things, and we do consider all of those. So that's all the different aspects of the value-added form. And it's important for us that you complete it, because, as I explained, there's a reason why we want you to have those as value addition when you apply to become a student here. And it contributes 20% towards the merit point score that we use for selection. So although the academic component is much more, it's 80%, the 20% does make a difference.
I want to ask, since you are saying it's better if you shadow different vets specializing in different aspects, but for example, let's take me, I come from a place where maybe vets focus on cattle and small pets, so I'm not exposed to vets working in a city or SPCA. So does that put me in a disadvantage if I only shadow those type of vets than someone who has shadowed a very wide group of vets?
No, it doesn't necessarily put you at a disadvantage. It will still help you. If it's possible for you to see, let's say in your example that there isn't a veterinarian close by that works with horses, just as an example. It would be good for you to try and find an opportunity to go and see a vet with a horse. So you need to ask the vets that are close to you as well, because remember, the veterinarians know each other as well. And you can ask them, do you know somebody that's not too far and maybe there's an opportunity for me to travel with? Even if I spend one day with them, it will be good for you, because then you will see a totally different world of a vet working in that environment. So try to find opportunities by contacting the opportunities that are available to you, because the vets generally know. I think yesterday Mrs. Henriette van der Walt also said, let's say there's a state veterinarian close to you. You can ask the state vet, are there private practices that are not too far from here, and maybe you can help me to get there. The other way around as well, because the private veterinarians usually know where the state vets are as well.
So what if I worked at a state veterinarian or maybe a private practice, but they work with all kinds of animals, like the small animals like dogs and cats and the bovine? Does that still count, or do I need to go to different places?
No, they can fill in on the form to declare what your experiences were. And then we will consider that, yes. But maybe, for instance, if you go for one day only, they may not see a horse on the day. So they're not going to give the information about horses on the form, and you might have to go back.
Yeah. Again. And maybe, so you said being part of maybe a team or something at the school. So if I was to say the captain of a sports team, is that good for my application?
Yes, it's good for your application, so you should give us that information. Yeah. Or if you, for instance, are doing a sport and you participated at provincial level or at national level, you must give us that information. So leadership, sport, and cultural activities, we do rank them according to whether it's at school level, extramural at provincial level, or at national level. So yes, it does make a difference.
Okay, let's say I've already applied at UP, but for different courses. I mean, it was before I was exposed to veterinary science. So, is it possible to change my courses, or?
That's a good question, and I was wondering if there were people like yourself who applied for something and now you want to change it and you already made the application. I think the best for you would be to contact Mrs. Henriette van der Walt at our student administration system and ask that you want to change your application, and they can assist you. So on our faculty brochure, you will find the contact information, or you can come and speak to me afterwards. We will make that available, the email address. We can also add it to the online version so that you can see it afterwards. So yes, you can ask, but you can't do it automatically on the system. You need to ask for assistance.
I wanted to ask, so does attending this event count as some sort of job shadowing?
Every year, students ask that. No, unfortunately not. No, because the experience here is in a bigger group, and it's not as personal as we would like to have it when you shadow a professional person. So we would like that to be a little bit more personal with yourself and a veterinarian or a veterinary nurse, where you can speak to the person a little bit more at a personal level. I think that's important for you. And also, people often ask us, people that are close by to Onderstepoort, if they can shadow here at Onderstepoort. Unfortunately, we don't do that. And the reason simply is that this is an academic hospital. We already have a lot of students in the setup. You saw this morning, for instance, how many students were around there, all trying to get an opportunity to have an experience. So our hospital just doesn't have the capacity to allow for shadowing as well. So we don't do shadowing here. Can I see who of you have already applied for one of our programs? I know about you now at UP, for one of our programs. So your applications are currently active. Just put up your hands. Okay, good. So the applications, I know some of you are grade 11 now, so you cannot apply at the moment, but you are here to learn how you need to prepare yourself. So for who are the grade 11s, just put up your hands. The grade 11s. Okay, what's the biggest message to you? The others must tell you, the matrics can tell you. Mathematics, physical science, English. You have to score good marks. So you must work this year in grade 11 to get your marks at the required level. That will make you competitive for entry into the program. Because we are going to, next year when you apply, we are going to look at your grade 11 final marks at the end of the year. And those marks are really important. And I hear sometimes there's confusion whether grade 11 is important or not, or what stage. So final grade 11 marks, really important, because it gives you access to the programs at university level. And then matric, obviously, although I told you yesterday that your whole matric will be as much as one of our modules in the second year, but matric, even for me, who already has a PhD, is your most important examination in your life. Maybe not the most difficult, but the most important.
I have a question. So I see the requirements to apply that biology isn't that big of a requirement, or it isn't a requirement. Why is that?
So life sciences in the nursing course, if you don't have physical sciences, you can have life sciences instead, and we will consider you based on that. The reason for that is that we have done quite considerable research on our own students over many years to determine which are the school subjects that determine students' success at university in our courses. And those are English, so language ability, mathematics, and physical sciences. And that's why we use them for selection as well. So although life sciences or biology will help you, because you will have certain things that you've already heard about, we will teach those things from scratch, basically.
Does University of Pretoria consider the average for grade 11 results in the selection process?
No, we don't look at the average. We look at 4 things. We look at the APS, which is the admission point score. And the admission point score you calculate based on your 6 subjects that excludes life orientation. And you get a certain score. So there's a table in the brochure that explains how that score works. And you need to have a certain minimum score. And then we look at mathematics, science, and English. You need to have a certain minimum score. We don't look at the average. So your other 3 subjects, as long as your APS is above the minimum required for APS, we don't look at the scores of those other 3 subjects. But we look at mathematics, science, and English. So we calculate an average of those 3 subjects only for your ranking on the selection list. And for that ranking, mathematics and physical sciences contribute a little bit more than English. So they contribute 30% each, English 20%, and then the value added form 20%. That gives you 100%.
So would you say it's easier to study in English than Afrikaans, or is it just?
Well, our whole course is offered in English.
Yeah.
Although probably only, I don't know, maybe 20 or 30% of maximum of our students are actually English first language speakers. Most of us, including the staff, are not English first language speakers, but that's the common language. So in terms of your schooling, if you are at a school where you have another language as your home language, we don't discriminate between English, first additional language, and home language. So what we are saying, in other words, if English is not your home language, and therefore maybe your English score, if you had to take home language, will be a little bit lower, so that will disadvantage you. Therefore, we consider the scores to be equal. So we don't look to see whether you are in home language or first additional language. We look at the score. Yes. So that depends on the school that you are in, whether they offer home language or first additional language for different languages.
So after applying, do I pay the application fee immediately after I applied, or do I have to wait a few weeks before I pay?
There is a small application fee that you need to pay in the beginning for your application to be processed. So you need to pay that, otherwise your application will not be processed any further. Yes. You will see when you go through the application, when you get to the end, you need to pay a small application fee for your application to be processed. But you pay the registration fee only when you arrive. And the bursaries usually will assist you with that. But the application fee you need to pay upfront, yes. So that small application fee is waived if you apply from a quintile 1 to 3, from a non-fee-paying school.
So,
I think we're over here, yes.
So if you do not meet the minimum requirements in grade 11 for veterinary and veterinary science, but then you work a little bit harder in matric, and then your matric results are much better, does that count for something at least?
So if in your grade 11 marks were not good enough for the minimum requirements, you've got two options. The one would be to try and get into a BSc program and then apply from there. The other would be, if your matric is good, you can apply the next year. But then you have to have a gap year. So you cannot then enter any tertiary education, and because if you enter tertiary education, it's got to be BSc.
Okay, you also said that in order for your application to be processed, there is an application fee that you must pay, right? So if you are not accepted into the premises, do you get a refund or something?
No, you don't get you don't get a refund. No. Riranzo, how much is that fee now? 350 Rand or something? 300 Rand. No. You don't. We use the fee to process your application, basically. So whether you get in or not, we've used the money.
So my question is, where do you attach the affidavit or the letter from the school that you are from a non-fee paying school? Do you attach it where you have to attach your proof of payment? Or
Riranzo will explain. Just wait for the mic, please. Thank you.
It goes with your documents. Remember, you have to submit your copy of ID, your grade 11 report, and then you attach that letter. So it goes together. So where you're supposed to say payment, it will give you that option of a waiver because you are from a non-paying fee school. Thank you.
So all the documents are uploaded in the same place. Also for your value-added form, you've got one portal where you upload documents, and they all go and lie behind the system, behind your name, which will include your ID, your grade 11, and then all your value-added form evidence papers as well. And our people on this side will download them and they work through them.
For example, I am doing an animal health at a college in Tsolo. So I'm in a process of applying. So by the end of this year, do I have to attach my results to the application, or maybe I just use my grade 12 application?
So if you're already in tertiary education, you need to enter a BSc program. If you apply for BVSc, your application will be rejected. So you need to apply for BSc, start with the first year, and then apply during your first year. And then your transfer is from first year to second year. So you still continue with the same timeline. But you need to apply in the first year, BSc. Then, yeah. That's the route.
Okay, so you cannot like use the grade 12 results to apply.
Sorry, you can't?
Use the grade 12 results only to apply.
If you are already in tertiary education, you have to go through a BSc course.
Okay.
Yes. But if you're in a gap year, if you are not registered at the institution in the year after matric, so you've now got your matric certificate, then you can apply.
Okay.
If you're in a gap year. But if you're at another university or you're studying a different course that's not BSc, at any other institution, you need to first go into BSc and then apply from there. That's the route.
I wanted to ask if NBTs are important, and then what if you fail your NBT but you met your minimum requirements for grade 11?
So, Mr. Petrus explained yesterday that the University of Pretoria doesn't look at NBTs anymore. And I'm happy and proud to say that this faculty was the faculty who started that. That we said we don't want NBTs. Because some people don't have access to training in NBTs. It's not a fair system. So now the whole university did away. Some other universities still require NBTs. And NBTs in terms of benchmarking is good. But it's unfair in the sense that some people can get training because they can afford to go for extra tuition and they can get very good NBT scores, and other people don't have the means. So it's not a fair system. That's the University of Pretoria's view. So we don't look at it at all.
So, Prof, do vets get immediately employed after graduation? Like, is the profession in demand?
Very, very much in demand. So after graduation, you get employed by government for 1 year. Automatically. If you're a South African, you get placed in compulsory community service for 1 year, so you're guaranteed you're going to have a job. And then during that year, you apply for your next job. And there's a massive demand. So you can choose where you want to work and what type of work you would like to do. That's how good the demand is at the moment. For veterinary nursing, even better. Most of our veterinary nurses, when they're in their 3rd year, they already get recruited by practices to come and work.
I wanted to ask if I can apply with an SAT score, because I'm doing online of an American school, so I wanted to know if I have to apply with my grade 11 marks.
Yes, so it's grade 11 or equivalent. So if you're in an alternative schooling system, then we've got a table in the brochure that explains how the scores are converted to be equivalent to the National Senior Certificate, to calculate what the minimum requirements are. If you are in an alternative schooling system, we have a slightly unique category for you. So you will compete with other students that are in a similar system, because the standards are not exactly the same as National Senior Certificate. So otherwise it would be unfair to you. Yes, but you can look at the brochure. There's a table that explains, so you can see what your scores were and what the equivalent National Senior Certificate will be, and that according to that, that's how we will interpret your results. So whatever is the equivalent of grade 11 is what you submit. Yes. It's all explained in the brochure in quite a lot of detail, but if you have anything uncertain, you can email Mrs. Van der Walt, she will help you. As long as your application comes in, we will do the calculation for you as well, in any case, because all your applications are verified by a team of people that go through the paperwork. Do we need to repeat something about conditional admission or conditional selection? Do you remember what that means? For those that are now in matric, that have applied, must I repeat what conditional means? Okay, so because you apply with your grade 11 scores, the grade 11 scores of different schools are not necessarily comparable. In some cases, the province will do a benchmarking exam or test, but most of the time the school determines your score. And therefore, we need to, in order to be fair to everyone, we need to verify with your matric results that those were actually correct. So when you apply in matric, we conditionally admit you, but then we wait for the matric results to confirm that your 80% for maths or whatever you had in grade 11 was actually true. And how we do that is that you need to maintain your scores. We allow a little bit of a slip because, you know, one exam can be maybe a little bit more difficult than another. So we do acknowledge that. So we allow a little bit of a drop. But if you drop below a certain percentage down from your grade 11, then you lose your place. Then you will be reconsidered in the January selection, where we again consider all the applicants based on the final matric results. So you are then automatically enrolled again. So it does sometimes happen that maybe you were number 1 on the list, right at the top. Your marks have dropped a little bit. You lose your place, but then you regain a place again when we do the reselection. Or you could lose your place completely as well. So the grade 11 marks are important for conditional selection, but then you need to maintain those scores in matric. For maths, science, and English. We don't care about the rest. As long as you still have the minimum APS, we look at those 3, the average of the 3. So you need to keep working. If you had a good grade 11, you need to keep working and keep it there. I think often you guys actually do better in matric. If you are motivated, you do better in matric. But we do occasionally find people that lose their places.
So if you have applied here at UP, how long does it take? How long do you have to wait to know if whether your application has been approved or not?
So we try to do ours a little bit earlier than the rest of the university in our faculty, which is why our applications close at the end of this month. So for this faculty, the applications are only open for 2 months, not for 3 months. And then during June, you have time to finalize your value-added form. Because at the end of June, there will be like a week school holiday, which will give you time to go and do some shadowing still. And then you can submit your forms at the end of June. And the selection then happens during July. So usually early August, we will inform you about whether you were successful or not with a conditional placement.
And how does residency work? Is there a separate form?
Sorry, residence?
Yes.
Yes, when you apply, Riransu can maybe help with the answer. Just wait for the mic, sorry.
When you apply, simultaneously you apply for residence. But like it was stated yesterday, first year vet science, it's in Hatfield. So you must apply to all the residents, whether male, female, residences should be in Hatfield. Then in your second year, then you'll be transferred here, depending on whether you maintain the required GPA or not.
And if you are for nursing, first year you apply for residence already here. So the first year nurses are on our campus. In other words, what he's saying is you cannot apply for OP Village residence if you are a first year veterinary science student.
So what advice can you give to someone who loves both the Bachelor of Veterinary Science as well as the veterinary nursing? Like, what will be the main factor that will determine which direction I will most likely be drawn to take?
I think Tumelo must help me with this question. It's a good question. It's just that I think a younger person must answer the question who is currently in the studies.
So, like they've mentioned yesterday, so once you get into veterinary nursing, you cannot from first year get into veterinary science. So if you really want vet science, the best thing you can do is apply for veterinary science and BSc. And then from BSc, work really hard and then try to get to BVSc. And the reason for that is with your BSc, your modules are similar to the ones that they do. So it's easy for you when you do really well to get transferred, and then you do only one module, which is a first year module, and then you can come to OP. So if you want vet science, it's best to start with vet science, and then if you cannot get in, do BSc. But if you apply for veterinary nursing, the only way you can come back to BVSC is after you finish, or if you use your matric results again and hope that things are a little bit different. So if you are willing to consider veterinary nursing and finishing it and working and maybe seeing if you actually enjoy that, you can actually do it that way. But if you do veterinary nursing with the hopes of doing veterinary science, then you're going to be here a little bit longer. So I guess it's a personal question that you have to answer yourself. Do I take the risk and do veterinary nursing, which is similar and also very fulfilling? Or do I stuck it out, do 1 year of BSc, which is what you do in any case, but now competition is very difficult, so you also have to work really hard in first year of your BSc. And if that doesn't happen, you also still would have to continue with BSc.
If I can add to that as well, before you take the mic again, is I think in the end, because you are in a situation where you love both options, you have a passion for both, and you're not sure which one is the right one for you. I think the best thing that you can do is to try and shadow more, and shadow those specific professions, so that you get a deeper understanding of what that person's work life looks like. And where do you see yourself? Because there are differences, although the two work together in a team, there are differences in the personal way that you experience your daily work. And you need to go and see and experience that with a professional person, that you can see where you see yourself, where you fit better. That would be the best way to answer that question. It's something that you will have to figure out. And the best way to figure it out, I think, will be through shadowing. Because maybe one day you will see something that you think, ooh, I don't like what I see. I don't think I can do this. I should go the other way, for instance. So until you have that experience, you may still be a little bit uncertain. And I think more shadowing will help.
After what you just said, I just wanted to ask, let's say I choose to go to BVSC, but then I have to study my BSc first. So I study my BSc, and then competition ends up being a little tougher than I expected, then I don't get in. So after I'm doing my first year of BSc, can I use that to go to nursing?
Yes. Yes, you can still then apply for nursing. We do transfers into veterinary nursing as well, and the route to veterinary nursing is open. It's not like for BVSC, the route is very strictly through BSc. It's the only route. Into veterinary nursing, the route is open. So you can be in any other program and apply for veterinary nursing, and we will consider your application. Yes. So it's a little bit more open for transferring students.
Sir, did you say you have a PhD?
Yes, most of the professors at the faculty have a PhD.
Oh, then how did you go about your academic career?
For me personally?
Yes.
Okay, so I worked in private practice. I qualified in 1998, and then I worked in a mixed practice where I worked with different species of animals. Already then I enjoyed the production animal side, but I did work with horses as well and with small animals. It was quite a busy practice. And after 4 years, I thought to myself that I think I want to study further. And as a student here, it never crossed my mind, honestly. I never thought I would do it. But after 4 years in practice, I thought I want to learn a little bit more specific things about an area of the profession that's interesting to me. So then I returned to Onderstepoort, and I started here as a resident. Now, a resident is somebody who is training to be a specialist. So you are like the lowest ranked person in the academic system. And you are training while you are working. So during that time, you do a lot of hospital work, You do assist a little bit with the training of the undergraduate students as well, but you see mostly cases or patients on a daily basis, and you train over a number of years to become a specialist. And after that, which is a master's program, I then started with a PhD. And the difference there is that with a PhD, the focus is on research. With a master's program, we have two routes. The one is a research route, so you could already start like that. The other one is clinical, which is the specialist clinical route. Both of them give you access into a PhD, but the PhD is always research. So after becoming a specialist, I thought that I really like to do a bit more research and to try and find new knowledge and not only use knowledge that already exists. And that's when the PhD came in. And that takes another few years because you have to do a certain number of research projects. You have to publish them, and you have to then write up a thesis. It's quite a lot of work. But it's very rewarding once you have it.
So if I wanted to specialize in, let's say, wildlife, do I have to go and then come back after the 6 years and study again?
Yes, if you want to go into the clinical specialty MEd Vet program, then we require you to have at least 2 years of clinical experience before you enter. So you can use your CCS year as 1 year, depending on where you were placed. If you were placed in an office job, we will say, no, that's not clinical work. But if you were placed in a clinic, we will say, yes, it counts as clinical work, and then you need to do 1 further year clinical experience anywhere, and then you can apply to enter the residency or the specialist program.
And how many years would that be?
It's a minimum of 3 years, but in most cases it takes a little bit longer than that, usually 4 years. But some people do finish it in 3 years if they work really, really hard. But you know what also happens typically in your life at that time is you typically have a family, you might have small kids, and things go a little bit slower. You have to have a life as well.
I think also to add for veterinary nursing, it's almost similar where after the degree you do your postgraduate diploma, which is an equivalent of an honors degree. And then from there you can do your master's. And then from master's also do PhD. So you can have a doctor who's actually a nurse. But for nurses from master's level, it will be mostly for research purposes. So you'll be in research and in the academia space. So if those of you who are interested in also teaching and being sort of lecturers or even into managerial positions at places like OP or anywhere, you can also go as far as PhD with nursing.
Yes, so in the academic workplace where I'm working now, if you want to go beyond a certain level, you have to have a PhD. It's required. So whether you started as a veterinary nurse or as a veterinarian or any other profession, you need to do a PhD because you need to show that you can do research as an academic person. But that's a long time in the future. Dreams. More questions? Conditional, I think we discussed.
Something you just briefly mentioned was your personal life and possibly having kids and slowing down a bit. I think it's something we haven't actually discussed with our learners, this idea of work-life balance and the fact that as a student, you should have a personal life. You shouldn't just be studying. So Prof, if you can give us some wisdom on that issue, please.
Yes, thanks. That's really important. And I think it's important that we give a disclaimer as well to say that the workplace of a veterinarian and a veterinary nurse can be very stressful. And sometimes, if you don't have the mental resilience, it can get you into trouble. And you need to be prepared for that. So you need to build up the mental resilience that will make you strong to work in a stressful environment. rewarding, very rewarding, but also stressful. The two, unfortunately, do go hand in hand. And to do that, it's important that you have other things in your life than your work or your studies that make you happy or that make you excited. And this is why, even in the value-added form, we look at those things, because we do want our students to have a little bit more balance than just the academic side. So it's something that you need to start considering now already, especially those of you that are in matric and preparing for the matric exams. Even in your daily schedule, as you are time scheduling your day for studies, you need to say to yourself, where am I going to look after myself as well, and not only my studies? And do sports or do something, depending on what your interests are, that will help you to build that resilience that you need. So mental resilience, and it's not unique to veterinary science. A lot of the professions are like that. In veterinary science, we see that that especially young veterinarians do struggle with mental health if they are not well prepared. So we have a program in our academic curriculum for veterinary nurses and for veterinarians that we call Professional Life. And quite a large component of that looks at how do you look after yourself to prepare you for your profession. Make sure that you know things about how to look after yourself other than being a very good veterinarian or a very good veterinary nurse. It includes other things as well, like finances, like communication skills and all those things. Those are all important things to keep you happy in life. Because you can be a very good vet, but you don't know how to work with money, and then you will not be happy. Not yet.
Can you?
Yes.
Okay. So this question is not related to vet science or vet nursing. I just wanted to know if, let's say, you have applied on the website and unfortunately you didn't perform very well, or maybe you performed exceptionally well, can the university recommend a different course for you? For me, let me just say me.
It will be depending on your circumstances. So we would have to discuss your exact circumstances to see what an alternative route or an alternative option would be for you. There are always other options. And I think Christian mentioned yesterday that in some cases, you need to take an alternative route, but you may find at the stage that veterinary science is your passion and you really want to do it. And if it's your passion, you can do it from any route. I think that was his message yesterday when he did his presentation. So he explained that he started with a BA degree initially, and then later he realized that that's not what he wants to do actually. So you can find a way. There are always routes and means and ways.
I think to add on that, the university has got student advisors, those that are specifically to do that, to advise, assist students in cases where you don't know which route to follow. However, again, the system, as you apply, if you do not meet the admission requirements, it guides you on the options, those that are available based on how you performed.
Thank you.
So how long does bursaries take? How long does it take for bursaries to support you? Do they support you immediately when you start studying, or after several months?
Sorry, I didn't get it.
Like, how long does it take for a bursary to support you?
For a bursary to support you. Riranzi, do you want to take that one? We are aware, of course, of the NSFAS delays, for instance, at the beginning of this year that affected all universities. It was really frustrating to everybody. It eventually was resolved. So sometimes there are delays, but I think Riranzu can answer the question better. The university will be usually tolerant if there's a situation like that, that we will try to accommodate you.
Look, if you have a letter that guarantees that they will pay, then the university will allow you to register until the money starts coming in. And if they pay for everything, like your laptop, your study books, and all those type of things, you'll then be in a position also to access that money from the university, which comes from your funder. But again, if you qualify for NSFAS, I think another thing that you need to understand is they pay based on how you perform. If they say we are going to pay for your tuition and your accommodation, it's subject to how you perform. So you must pass 50% of your modules. Should it happen that in your first year you trip and you don't get the average which is required, normally they withdraw the funding. And I think it applies to most of the funders. They have specific requirements from you to say, for us to continue funding you, this should be how you perform throughout your studies. So you just need to understand what the funder requires of you so that you maintain that, so that you don't find yourself in a situation where you have to drop out because you did not perform well.
That's very important. All the bursaries almost exclusively are like that. That if you fall behind, they stop supporting you, and then it becomes a problem. Because now you don't have funding and you need to repeat. And it becomes really problematic. So I discussed work-life balance, and in some cases students go a little bit overboard on the balance side, and they party too much and they don't study enough, and then they really run into trouble. So it's important that you stay focused on your studies. You do relax, enjoy your life as well, but stay focused on your studies and know what your targets are and what you need to achieve, especially if you're on a bursary. Because, you know, sometimes you come from a background where you didn't have a lot of access to pocket money and so on during your schooling years. Suddenly you get a bursary from NSFAS or from somebody else, and they give you nice pocket money. And you start to enjoy that too much, and you forget that if you don't perform, you are not going to have that anymore. So you need to try and learn those financial skills from the beginning and say, okay, I must be moderate. I'm not guaranteed to have this bursary next year unless I perform well.